Kia ora koutou katoa. Good morning. Welcome to the People's Select Committee on Pay Equity. My name is Leanne Dalzell. I'm a former Member of Parliament. I would like to invite my former colleague, the Honourable Nanaia Mahuta, to open proceedings with a karakia. Kia ora.
Tēnā tātou, whakataka te hau ki te uru, whakataka te hau ki te tonga. Kia mā kina ki uta, kia mā taratara ki tai, e hia ki ana te atākura he tio, he huka, he hauhunga, ti hei mauri ora.
Kia ora. Thank you very much. As a People Select Committee, this is unique. It's the first of its kind, and it's an opportunity to hear submissions from people who have something to say about the pay equity legislation that was passed under urgency earlier this year. It's important that we document this for the future, and that we are enabled to be able to develop a true understanding of all of the elements of pay equity as we go forward. But as a People's Select Committee, not a parliamentary select committee, we are not covered by parliamentary privilege, which means that we are governed by the ordinary rules. Defamation is one that springs to mind. So I would just ask that people be cautious when making remarks. We have read all of your submissions in detail, and we thank all of our submitters today for the amount of effort that they have put into their submissions. We'd like you to speak to the main points and to leave time for questions. I should introduce my colleagues, of course, Dame Marilyn Waring, Steve Chadwick, Belinda Vernon, Ria Bond, Lynn Pillay and Jackie Blue. And of course, we cover a spectrum of the political parties in Parliament, which I think makes this a very credible body to be able to listen to the evidence that wasn't heard before. So on that note, could I invite our first submitter, the Asian Legal Network, to present their submission. Kia ora, thank you. How are we going? Have we got the Asian Legal Network there?
Hi, I'm not sure if anyone can hear me.
Yes, we can hear you fine. Are you able to switch on your video or?
I am attempting. One moment, sorry.
That's all right. There you go. Thank you. Now we have read your submission, so please, speak to your main points and see and leave some time for questioning. Thank you.
Awesome, thank you so much, and apologies for that. You'd think after COVID and everything, I'd be a bit more fluent on technology. But good morning, morena, and Zashangha, everyone. My name is Aria. I am a lawyer in Auckland, Tamaki Makaurau, and I am here presenting on behalf of the Asian Legal Network. And we present our submission strongly in opposition to the Equal Pay Amendment Act 2025. Just a brief intro about us. We are an organisation of lawyers, former judges, academics, researchers, and community advocates. So as part of our advocacy, our aim is to provide you, lawmakers and government officials, with perspectives on how proposed legislation can affect Asian peoples, especially those who are more marginalised in our community. And on that basis, we oppose the passage of this act. And I know you've said that you've already read our written submissions, but as a very high-level overview, we make 3 main points of contention in that written submission, and we oppose the act on the basis that first of all, it undermines Asian women's access to pay equity. Secondly, it undermines Te Tiriti o Waitangi. And lastly, it also brings about grave concerns in regards to constitutional impropriety. Now, we've already seen and heard and read a lot of submissions in relation to the third point about constitutional impropriety. So in the interest of time, we may park that point and defer to our written submissions on that part. And I'd like to focus mainly on our submission about it undermining Asian women's access to pay equity. And we say that the Act undermines Asian women's access to pay equity for mainly three reasons. First of all, we have concerns about it retrospectively blocking current pay equity claims in which Asian women may be overrepresented. And secondly, we believe that it exacerbates the ethnic gender wage gap for Asian women. And lastly, we have concerns about it raising the threshold for bringing about a pay equity claim, which reduces visibility and accountability and also creates extra burden on a group of people that are already facing significant struggles and also roadblocks in having their voices heard. So turning to the first point about the retrospectivity of the pay equity claims, I won't go into too much on the concern about retrospective effects as a point of lawmaking, but what we do know is that there are 33 claims that are currently underway, which have been impacted and halted by this Act. And in these claims, there are groups of workers that are representative of female-dominated, undervalued roles. And our particular concern arises in, for example, sorry, I see someone raising their hand.
Oh, it's okay. If you carry on with your submission, they're just indicating to me that they will, and I will call Lynn Play as the first person since she's put up her hand first. Will you put your hand up?
Yeah, I didn't realise I had, but that's fine. That's fine.
Yeah, we'll come back to you.
Sorry.
Sounds good.
That's right. Carry on.
All right, so going back to the point, our main concern is that in these 33 claims that have been halted by the Act, it represents workforces that are dominated or in which Asian women may be overrepresented. For example, there are 10 claims that are put forward by the New Zealand Nurses Organisation. Now, I won't claim to speak on their behalf, but what we do here in our community is that Asian women from all across the spectrum, all across the demographic, are often overrepresented in roles that pertain to care, that pertain to nursing, pertain to, the care of the elderly and the sick. And we have strong concerns that a halting of this claim will therefore disproportionately impact the Asian woman in our communities. And the second point, that the Act will exacerbate ethnic gender wage gap for Asian women. At this point, I'd really like to highlight some statistics that we've seen and that we've read. And I guess one of the more jarring ones, one of the more jarring examples we've seen is from the Inland Revenue Department. So they report that the current average ethnicity pay gaps are 13.4% for Pacific peoples, 15.9% for Asians, and 8.45% for Middle Eastern, Latin American, and African people, and 8.06% for Māori. And at this point, I'd like to sort of raise a centre focus of our submission, which is the concept of intersectionality and how different factors interact, such as race and gender, to exacerbate the discrimination certain groups suffer. For example, the experience of Asian women. It is the importance of intersectionality in policy making, because with those numbers in mind, if we add on the layer of both race and gender, we see these pay gaps increasing. So, for example, for Māori women, a pay gap is sitting at 21% per this IID report. And for Asian women, it's sitting at a staggering 24%. And it's also sitting at 24% for Pacific women. And a very interesting point to note is that over the past 5 years, pay gaps have been decreasing across all groups, except for Asian women, where pay gaps have actually increased. Now, we bring these statistics because these are not just abstract numbers on a page. These are real people, real experiences, and real livelihoods from those in our communities. We see the reality of these statistics in our communities. We see Asian women being passed over for interviews, particularly if they have ethnic sounding names. We see Asian women being dismissed and perceived as less intelligent or professional, particularly if they have a strong Asian accent. We see Asian women with incredible qualifications and experience from overseas struggle to receive recognition for their competence in New Zealand, while we see their Pākehā counterparts readily transition into comparable roles and life in New Zealand. So we know these statistics of the ethnic gender pay gap, the staggering 24%, and actually, according to a report done by the University of Auckland, it can be as high as a 33% pay gap for Asian women in their workplace. We know these statistics are real because we know stories of discrimination within the workplace on the basis of gender and on the basis of race are very much well and alive in our communities. We read about these stories, we see these stories, people come to us with these stories, and we live these stories. I myself live these stories as well. Now, I see there are quite a few hands raised, so I wonder if it's best for me to pause here, maybe take some questions, so we allow ample time for that communication.
That would be very good. Thank you very much. Very much appreciated. Lynn Pillay and then Jackie Blue.
Thank you so much for a very compelling submission. And just in terms of your research and advocacy, your members, it must be very far-reaching. Did you have any inkling whatsoever with all of your contacts about this proposed legislation of any change at all? Was there any hints or anything, or did you just literally not see it coming?
We've been very much blindsided, sadly and unfortunately. We have not heard any news of consultation. We were not involved in any sort of outreach. We were not really considered, and I think like most other New Zealanders, we found out about this shocking news on the news.
Thank you.
Thank you. I've got Jackie and then Dame Marilyn.
Thank you, Aria. Asian women are most certainly the backbone of our nursing workforce. Have you heard of reports that the Asian nursing workforce, whether it's locally trained or internationally qualified, will be exiting New Zealand?
Unfortunately, I don't have any concrete reports on that. I think the reality is that there are many barriers for those Asian women in our workplaces and in our communities to even understand the implications of an act such like this. I think the implications for those in our communities will be very far-reaching, but perhaps not immediate as people are processing what this really means, and especially Asian women who historically have struggled to have their voices heard. They may not even know what this means in terms of their rights and their abilities to protect those rights. So we're happy to write a supplementary submission and present it to the People's Select Committee if there's interest in that. But yeah, that is my answer on that point.
Just a very quick...
That would be very helpful, Aria, but I just do want to go to Dame Marilyn, but we will follow up with further questions if we've got some, but if you could submit that additional advice, that would be very helpful. But I think that we will also potentially have other questions that we could submit through to you to cover off as well. Dame Marilyn?
Thank you, Aria. Just very quickly, And I wonder if it might be worthy of another paragraph or two as well in a further submission. So I'm interested, you're not the first to draw our attention to intersectionality. The first with respect to Asian women, of course, but not in general. And I understand that the original tool, in fact, could be adapted for intersectionality. And just listening to you, I was thinking of, the various resort to Asian women in something like the health sector as translators and a whole range of other things that they're not necessarily employed to do. So yeah, you've mentioned it as a concept. I would love to have just a couple of paragraphs on how you think that might work in process.
Certainly, thank you so much. And that's certainly something we can incorporate into our supplementary submission. And I know you mentioned the concept of translators, etc. And I certainly, pay respect to the work that's already been done by those in policy and in government to increase accessibility. However, my personal experience and our experience at the Asian Legal Network is, despite those translation services or tools of accessibility, people on the ground still face significant barriers. I volunteered for the Citizens Advice Bureau for many, many years, 4.5 hours a week, I think across 4 or 5 years while I was doing my law degree. And when I use translation services, I found that you have to actually speak English and understand English first and go through 2 or 3 English prompts before you even have the option of accessing that translation service. So it's like little examples like this that we can certainly incorporate and include in our supplementary submission.
Look, I'm going to move to Steve Chadwick, but I'll come back to Jackie if we've just got a minute at the end. I'm just trying to manage so that everyone gets a chance within the time frame. Thanks, Steve.
Thank you, Aria. This is quite a different perspective and very valuable. I wonder, it's a supplementary to Dame Marilyn, really, that in your response, it might be worthy considering involvement in the co-design network, so that Asian women's voices are part of one team that developed that Te Oro Waru framework. It might be worth you mentioning that in your supplementary response.
Thank you. We certainly will.
That's great. Jackie, quickly, 1 minute.
Very quickly, do you think there is an understanding of what pay equity is in the Asian community? Certainly, some ministers have commented that government ministers don't seem to understand it. So, just your thoughts on that. Thanks, Aria.
To be frank, I think the understanding demonstrated across the board and certainly demonstrated by this Amendment Act is a very limited, if not perhaps non-existent.
Thank you.
Thank you very much for your time, Aria. That was an
you.
excellent and a highly valuable perspective. So we appreciate you making your time available this morning. Kia ora, thank you.
Thank you, and grateful for the opportunity to present to you.
Great, thank you. So now we'll turn to Anna Gilling, and if she can come onto the screen. I know Anna from way back. Kia ora, Anna, are you there?
There's a small lag, isn't there?
There is a small lag. I thought I saw her name there before. Oh, hello. Nice to see you.
Yes, you too.
Morena.
Morena.
Yes, now you've heard us say that we've read the submissions, so please speak to your submission and leave some time for questions. Thank you.
Kia ora koutou, everybody. Good morning. Thank you very much for the opportunity to speak to my submission. I do want to go over just the key points very quickly to leave time for questions. I am profound, as I introduced, my name is Anna Gilling. I'm a feminist, a public servant and a political scientist. and I worked as a public servant on the 2020 Equal Pay Amendment Act. But I've been committed to pay equity my entire life, and come from a very long line of women activists in terms of equal pay and addressing gender discrimination. I am profoundly opposed. This is very bad law, and it's bad law for all the reasons that all the other submitters have canvassed much more substantively than I would like or I need to. But just suffice it to say, this is law that was passed under urgency. It's retrospective. It deliberately excluded the main ministry who would have provided the gender analysis to support and to shape the law to promote women's interests and economic autonomy in the labour market. It cancels a huge number of claims already in progress that represent hundreds of hours of work and the good faith that's wasted between employers and claimants. But I think the most important thing to say of this law is that the government has stripped it, the Equal Pay Amendment Act, of all of its industrial and intellectual and policy strength. It is no longer a pay equity law. It is the most bare bones equal pay law. We might as well have gone back to the 1970s equal pay law and have no pay equity framework for claims at all. That in some ways I think that might have provided a better basis. It certainly would have been a more honest place to start for this government. So suffice it to say, I support the call from all of the submitters, unions, women leaders, CVEP, etc., to repeal this particular law. But I wanted to highlight a couple of the arguments that were made during the development of the 2020 Act, which I think have re-emerged in this government and in public discourse, which I think the committee is very, very well placed to address head on. And the first of those, as I've covered in my written submission, is that women aren't underpaid because they're women. Women are underpaid because they go into low-paid industries, and that the choice of women in the labour market is itself a good thing, and that the government, employers, unions, no one should interfere with women's agency in the labour market. The second argument we faced was that employers aren't knowingly underpaying women, they're just paying market rates for particular kinds of work, and that these market rates are arrived at through some sort of magical, neutral, completely objective, ahistorical process, and that employers themselves are subject to this and therefore they can't interfere in it in any way. That to interfere with market rates by agreeing to a pay equity settlement that increases women's wages is to blame individual employers for a sexism that is society-wide and that unfairly places the burden on employers to fix it, rather than seeing employers and employees and women as participants in a labour market that is deeply gendered and discrimination against women and women's work. And I think the last point that is perhaps the most fundamental of all, that pay equity is an unmanageable fiscal risk for not just this government but all governments, and that it cannot be afforded. It cannot be afforded now, it cannot be afforded in the future. I think we saw in the announcement of this act in May that explicit "we cannot afford pay equity in New Zealand" as a government discourse, I think was very clear. And certainly when I was at some of the protests in front of Parliament, there were women there who said they'd never been at a protest before, but they felt that their money was being stolen by this government, and that had caused them to come out to publicly oppose this act. So I think the power of this select committee is to go into the details of the act, and the submitters have been, I think, fantastic to date. But I think there is a special role to reject these arguments and to place pay equity back into the context that women are being deliberately underpaid because we have gender discrimination about what women do, how they do it, whether it's valuable, whether anyone can do it. And what is the role of good faith bargaining to get to a fairer settlement? And I think this select committee could make a very powerful statement that pay equity is addressing underpayment to date and is an investment in the economic autonomy of women and their whānau, and is an investment in society that will provide economic benefit. It is not a cost to be borne by a government and to be, limited as much as possible. I think I'd like to leave it there, if that's okay.
Yeah, no, that's tremendous. Thank you very much. And it points us in a very good direction in terms of some of the issues that we should be at least articulating and responding to in this report. Jackie.
Anna, I loved your submission, because you were actually there developing the framework for the Equal Pay Amendment Act 2020. And you reference in your submission arguments from MB and Treasury against pay equity in the development of the 2020 framework. And you then make the counter argument against those arguments they put forward. And clearly the counter arguments prevail because the 2020 Act went through unanimously in Parliament. What is concerned with this 25 Act and it coming through in secret is, where do those officials from MB and Treasury sit? Are they still hold those arguments that you outline in your submission? That is my concern. We appreciate your comments on that. Thanks, Anna.
Thank you for the question. I don't know specifically. I can't speak to who are the senior officials at MB or Treasury at the moment. But I think the fact that the law is written the way it's written is that those arguments that we addressed and thought we had vanquished in 2020 have re-emerged and have held the day. That they're seen, pay equity is seen as a cost. It is a fiscal risk to government. It must be limited. One of the sort of prevailing ideas in 2019 and 2020 was that this could open up unlimited financial claims from women. But the CTU and Business New Zealand, to be fair to Business New Zealand, understood that they were social partners in a process to get to legislation that was robust and that required good faith on both sides. And that carried the day, I think, in 2020. That is not the case now, which is why I would urge you to address some of those arguments which have re-emerged and clearly hold the day now.
Thank you, Anna.
Thank you. Marilyn, Dame Marilyn.
Thank you, Anna. The signatories on the advisory group are Phil O'Reilly, Paul Stocks and Lewis Holden. Are these the same people that you're talking to in 2020, or are they the people whose names appear on the cabinet minutes and advice to government from 2023 to 2025?
They aren't the same people we dealt with in 2019 and 2020.
They're different people.
They're different people, yeah.
Thank you.
Thank you. Belinda Vernon.
Yes, hi. Look, a very compelling discussion. I want to pick up on the elephant in the room, which you have attacked straight on, which is the fiscal risk, the unmanageable fiscal risk issue. Because I think there is clearly a huge cost to this, and therefore, how does a government manage that, and does it do it by I guess prioritising or rationalising, or you're prioritising who needs to get pay equity first? And is that, so how do you deal with that? Because
there is clearly a significant investment, and I think your point there is dead right. It is an investment in the future, but the lag time is huge, and so therefore a government does need to manage it. How does it do it?
I think it's an incredibly important question, and the answer, my answer would be twofold. The first one is that the need for legislation in 2020 emerged out of the Bartlett claim being settled, and the fear from government and from the business community that this would leave all employers open to claims going through the courts, and that therefore the government could have absolutely no control over or guidance or sense of limitation or sort of shaping what those fiscal settlements might look like. So they entered into decided on legislation that would provide a framework where employers and claimants and unions and women's groups could work together. And the answer to dealing with fiscal risk in that respect is to have a very robust process. And there was absolutely no sense from women or from unions in 2019 or 2020 that this was an open checkbook. Absolutely not. And every woman claimant understood that, for example, in a small firm, if you had a pay equity settlement that significantly increased the pay of the workers who were there, this would be an issue that the employer would have to deal with and would have impacts on their ability to expand, to hire new staff. So there was absolutely no sense in 2019 or 2020 that this was an open checkbook for government. So you put into your framework really robust systems, including prioritisation of claims. The other thing to remember is pay equity settlements are largely about pay rates, but they're also about conditions, and they're about access to improvements in conditions. And so businesses and employers and entire sectors of the labour market can manage that in a multitude of ways now that address that fiscal risk. I mean, we have to be honest, it is going to require government to open the checkbook, absolutely. But my argument is that if you put money into the pockets of women who are some of our lowest paid, doing some of our most important work, they will spend it in their local economies. They will spend it on their children. If you can call it in a budget, regional development funding, then you get the same bang for your buck. And you take it away from the sort of political discourse that this is a cost and a burden and a way of blaming individual employers for being sexist, when they are, I'm sure, and I know many employers, trying to do the best by their staff.
Look, that's very good, Anna, and I'm going to cut it off there because of the time, but there may be additional questions that, if it would be all right with you, we could submit to you for some further comment. Your submission has been incredibly helpful, so thank you very much for that. And I will now move on to Erin Jackson from Project Gender. Thank you, Anna. And if Erin Jackson is there. Hi. Kia ora. Welcome. We've read your submissions, so if you could just speak to the main points, but leave some time for questioning. As you can see, it's very valuable. Thank you.
Absolutely. Kia ora, thank you. Ata mārie koutou, ko Erin tōku ingoa, no Airangi o ko Tipuna, ko Otatahi te whenua tupu, ki te noho o ki Tahuna. My name is Erin. My ancestors are from Ireland. I grew up in Otatahi, Christchurch, and I'm currently based in a very rainy Queenstown. My name is Erin, and I'm here today as the co-director for Project Gender. Project Gender is a social change agency creating positive impact through insights research, breakthrough campaigns, and real-world solutions. We are committed to ensuring women's voices are heard, valued, and centred in the decisions that affect our lives. I'll be presenting on behalf of our team today and talking to the research and insights that demonstrate the importance of listening to women who are the experts in their own lives. And listening to Aria and Anna's submissions before, I think there's a common theme coming through this morning. As we know, pay equity is not just a technical issue of wage adjustments. It's about justice, dignity, and ensuring women are fully recognised for the work that they do. It's about correcting generations of structural inequity. And yet, in the development of this legislation and the processes leading here today, women's voices have not been adequately centred. There are two main concerns that we wish to raise. Firstly, the lack of democratic process followed by the government, as has been well covered by other submitters to the People's Select Committee. But the voices of the very people this legislation is meant to serve, women in undervalued and underpaid sectors, have been completely silenced by the legislation passing under urgency. This is not democracy, and it's decision-making about women without women. When women are not meaningfully involved in shaping the processes that impact them, their lived realities and their financial precarity, their struggles to balance work and care, the deep intergenerational effects of inequity are sidelined. And secondly, the second matter we wish to raise is that the pay equity law change has created a distortion of priorities. Pay equity has been framed as a matter of compliance and cost rather than justice and social progress. As a nation that has been acknowledged internationally for our record, we have come too far to backslide on equity. So today we thought it would be worthwhile to talk about the research and data that we hold. And for context, our agency Project Gender came out of the Gender Justice Collective, established in the lead up to the 2020 election. Founded by myself, Angela Meyer and Tanya Demet, our mission is to amplify women's voices where they have historically been silenced or ignored and bring about radical positive change. We have long backgrounds in community organising advocacy between the three of us. And ahead of the 2020 election, Angela asked, what would it look like if we put an intersectional feminist lens across the party's policies? She formed the Gender Justice Collective, bringing together over 25 feminist organisations and individuals who were also interested in this particular question. This collaboration led to a world first. Instead of producing an electoral scorecard of the political parties' policy positions on issues selected by academics or advocates, which is common around the world, we instead went out and we asked 3,500 women, wahine, trans, non-binary and intersex people, what do you need to thrive in your life? What policies are most important to you? The responses to the YouChoose survey were astonishing. Many said it was the first time they'd even been asked such a question. We then worked with Professor Jennifer Curtin at Auckland University to rank the election policies against what our research had learned mattered most to women. We were crowdsourcing the evidence and priorities from women themselves. So we identified the top 10 policy issues for 2020 from our over 3,500 survey respondents. And you'll never guess, but the number one policy issue of importance was pay equity. 87% of our respondents answered very important, and a further 11% indicated important when asked, and these are the exact words of the survey question, so no one was in any doubt as to what pay equity meant. How important is legislation to ensure pay equity, i.e. people get the same pay for similar work or work of equal value? This was the top rated issue for the policy area of fairness in the workplace, and the top rated policy issue across all 8 different policy areas that we surveyed. We remember at the time thinking, oh, well, that's okay. We don't need to work on that at the moment. We'll focus on healthcare instead. And we leaned into that as a result of our advocacy. And we went on to do, work as one of the key advocates for the National Women's Health Strategy, where thousands of voices shaped this work, and our research has since been used in Parliament. And we've demonstrated the importance of listening to women. And we learned that other people, such as decision makers, really start to listen when you have the evidence and data. This led to the development of a project called Mako Mama Mangapare, conducted with Ngāti Kahungunu, and we have the largest data set for what's going on in single parent whānau's lives across the motu. And we've gone on to do work in different areas since. But this matters, and we wanted to raise it with the People's Select Committee today, partly because we can see from the work we did back in 2020 that pay equity was top of mind for the women and wahine, trans, non-binary, intersex people that we surveyed. But in the development of this legislation that we're talking about today and the processes leading here, women's voices have not been adequately centred. Our data and our research isn't abstract numbers. It represents real people and lived experiences. It's women working long hours for low pay. It's the mental load of trying to make ends meet. It's families trying to make sure their kids have lunch every day, parents struggling to save for retirement, and women advocating for basic health coverage and fair treatment. To overlook these voices is reprehensible. The legal and democratic arguments have been well made by others, but from our perspective, the onwards effect is chilling. And a repeated question during submissions has been about engaging the next generation. From what we see, young feminists are already engaged. They are angry, they're frustrated, and they're incredulous that they have not been listened to. And this gives us hope. So currently, with the support of the Clare Foundation, we've been exploring to look at how to communicate to mainstream New Zealand the history of pay equity in Aotearoa. And the project is focusing on making people connect with the basic issue of fairness and how do we take these issues mainstream? How do we help people to understand the human impact of inequity? So looking ahead to next year's election, the opportunity is before us to act collectively. Every person who's written a submission or appeared before the Select Committee has had a role in moving the needle. But if we don't continue to do so, we believe that women's voices will be continued to be silenced. Finally, I want to say this, that pay equity is not a favour to women. It is the fulfilment of a democratic promise that all work is valued fairly and that women are equal partners in shaping our collective future. We urge the government to act boldly to restore women's voices to the centre of this process and to ensure that pay equity is delivered both in practice and in principle. Because what we know is when you listen to women, good policy happens.
Look, thank you, Erin. I've just noted at the end of my notes, fulfilment of a democratic promise. I mean, that I couldn't find a better articulation of why this matters. So thank you so much for basically all the work that you've been doing, but also for presenting to us today and then thinking ahead to how do we articulate the wider story to the wider public so that they can understand what the issues are. I've got Steve Chadwick and Jackie Blue.
Thank you, Leanne. And thanks, Erin. It's very heartening for our generation to see this Project Gender coming through in a very well-researched way. My issue in the interim, because I'm sure you will look at manifesto in the next election, have you approached the women spokespeople for all of the parties about your research and asked for a meeting?
We've had, yes, we have, is basically, we have had a varying success over the years in terms of engagement and ongoing engagement with members of Parliament. And we have consistently sort of said, you know, we've got all of this data and this information and we'd love to work with you. And that's a good example of that is the National Women's Health Strategy. We're sitting with, you know, Dr. Verrill, and she said, you know, show us the case for it. And a whole lot of, you know, across the multitude, people went out and said, this is why it matters. And I think that ability to work collaboratively and lean on the research and also engage collectively, that's where the real magic can happen. And we'd love to find more ways to get access to do more of that. But there's been maybe less engagement in recent times.
Thank you.
Yeah. Jackie.
Oh, that was amazing. Thank you so much for your submission and your 2020 data. Incredible. I don't think I read that in your submission, but I was so interested to hear about it. Just two things. You talk about, you represent some of the most marginalised groups and you use storytelling as one of the things you do to promote your work. And I think a compelling story can be very persuasive and have emotional impact. Have you thought about using your stories as a way to highlight your unique perspective and perhaps send them to MPs? And the second question is, have you thought of becoming a political party?
That's a good idea. I love that. In terms of your first question, I think one of the things that we are particularly interested in is that storytelling element. And so you will have seen us actually in Wellington a couple of weeks ago, where we were sort of darting around talking to, you know, people who were submitting, and we've spoken to a few of you about this as well. And actually, how do we communicate the story and the impact of pay equity in a way that is accessible? And so that's why we're actually making the podcast around, you know, to enable us to tell it in a different way that's accessible to people to kind of bite size and start to understand that, but also start to understand that human impact. So I think storytelling with the research is at the heart of what we're doing, and we'd, you know, love to sort of find other ways that we can build that into the work in the coming months as well.
Thank you. Lynn Play. Oh, your sound, please.
Okay. Can you hear me?
Yes,
Yes,
thank
sorry
you.
about that. Thank you so much, Erin, for your submission. Just a quick supplementary to Jackie's. Your research, I found that, I think we all did, very, very, very strident and very compelling. And just wondered if we could please, if the committee could have that research or summary.
Absolutely.
Thank you.
Absolutely. We'll supply the YouTube survey, but also with the summary results as well, which I think might be interesting reading.
That would be amazing. Thank you.
Thank you.
Yeah, I think one of the things that sort of comes through, and I suspect that other people sitting on the panel will feel the same way, and that is that the coalition government's agreement with both of its coalition partners that have put evidence-based as a key priority for the way that policy is developed, and I think there needs to be a hook back into what was the evidence that backed up this change when they didn't hear any evidence from the individuals that were most affected. So you've certainly raised a very valid point in that regard.
No, thank you. And I think echoing Anna's submission from before me in terms of that lack of involvement and evidence supporting this when we're proposing to act in a way that is, evidence-led, it feels counterintuitive.
Look, thank you very much. I can't see any other questions there, but look, really appreciate you making your time available and for the work that you're doing in the past and obviously clearly into the future. Thank you very much for that. It's quite inspiring.
Thank you for the opportunity to be here today. Ka kite.
Thank you. And now we move on to the Home and Community Health Association. And I think we have Lisa Foster with us. Is that right?
That's right. Kia ora.
Oh, kia ora. Welcome.
Lovely to see everyone.
Well, we've all read your submissions, so do feel free to sort of touch on the main points that you want to make and then leave some time for questions for us, please.
Yes, no problem. So tēnā koutou katoa, ko Lisa Foster, tōku ingoa. And thanks so much. It's a privilege to be here today. I'm the CEO for Home and Community Health Association, or HCHA, and I'm joined by our chair, which is Murray Penman. And we just want to express appreciation for the opportunity to speak with you and also for the important mahi you're doing. Thank you. So HCHA is the national peak body for home and community support providers. We're a not-for-profit member organisation, and we represent over 40 providers right across the motu, ranging in size, location and kaupapa. Around 65% are not-for-profits, and 60% of our members are kaupapa Māori organisations. Our sector is predominantly government funded and, importantly, mostly female. The role of our sector is a vital one, and our workforce delivers 27.5 million hours of care every year with more than 26,000 workers. So it's the largest mobile workforce in the country. The care provided by our members keeps people out of hospitals, out of emergency departments every single day. It's usually unseen, invisible, because it happens behind closed doors in people's homes. But it's a vital service, and their work is fundamentally important to the health system. The mahi is not low-skilled. It offers vital supports that improve well-being and enable people to live with dignity in their own home, which is their preference a lot of the time. Removing the pathway for fairer pay undermines the very workforce that makes these outcomes possible. And despite the critical value of this and role of the HCHA members and the workforce, the sector's remaining underfunded and facing increasing pressure. So part of the problem is the fact that there's multiple funders that we engage with and multiple contracts. It's extremely complicated, and there's no clear funding model overall, no fair pricing, and no overall plan to create one. The decision to repeal the only process that we were instructed to follow for pay equity a process that was built to deliver fair pay for our essential workers, was shocking to us. And it sent a clear message that the complexity of the work and the immense value that we bring to the communities can be dismissed. And that's not just unfair, it's been devastating. Some of the points around workforce that I'll just touch on. So our support worker workforce is predominantly female, with many identifying as Māori, Pacifica, or migrants. They face growing complexity because we have an increasing need with the ageing population, and there's no clear workforce strategy for Kaiwhina to help support them in their career paths and to help to grow the workforce. Unfortunately, it has a high turnover, an average of 25% compared to the Te Whare Ora 10%. It's generally older, made up of older people than other workforces, with the average age of the workforce being between 50 and 55 years, and often low paid, with a pay gap of around $5 per hour between community-based workers and those paid by Health New Zealand in the hospitals and other areas. This pay disparity also affects community nurses, allied health professionals, coordination staff, administration staff. So there is a often a $5 difference between the people who are employed directly through government and people who are paid through the community settings through funded services. Despite the lack of a cohesive workforce strategy, our sector takes responsibility and trains support workers to do many tasks that are complex and need supervision. So they will use their clinical staffs, their own community nurses, and help to support the really vital work. And one example of this that I will just pause and say was, I heard somebody actually had a serious event at home, and the support worker was the only person there and had to phone the nurse who was available to talk her through CPR to save that person's life. You know, so we are talking situations which are life and death at times. Obviously, that's an extreme example, but that's the kind of thing that isn't seen because it didn't happen in the hospital. It isn't in the media. So they often are acting as the eyes and ears of the community for many people. And sadly, we struggle to recruit younger workers, mostly because of the pay gap that I've just explained. And as an example, you know, why would a person start on a low wage, which was close to minimum wage or minimum wage in some cases as a support worker, when they could start at Kmart or another big box retailer on a living wage? It doesn't make sense. So the government have commissioned multiple reports over many, many years, and all of those reports consistently highlight the need for a major expansion of home care services and the demands of an aging population and the fact that it's underfunded. And yet we can find no corresponding workforce or funding plan. The removal of the pay equity pathway on top of that is a tragic missed opportunity, especially for a workforce that is overwhelmingly female and already seriously undervalued. So are we expecting families or untrained individuals to step in and manage increasingly complex care? To do so is not sustainable, it's not safe, but yes, it would save money. The pay equity process has already demonstrated the level of skill, the level of responsibility, and the value that is expressed in this workforce. And to cancel it now with no alternative in place sends a deeply discouraging message to the sector, to its leaders, and to that committed workforce delivering care. So where does this leave employers? There's no structure or plans to follow, and each is left to their own. So I'm going to hand over to Murray to talk about the background. It's very complicated, so please bear with us, and the process we followed and the impacts that were directly made on providers. So I'll pass to you, Murray. Kia ora.
Thank you, and thank you for your time. So as part of the support worker pay equity process, the HCHO CEO was appointed as a hybrid representative for member providers. This is for the care and support worker process. And that meant that we acted as a bridge and connector to assist the journey for everybody in this process. What we didn't realise is how much time it would take to do this, and the time is necessary, obviously, to make sure that we are understanding the actual challenges and the undervaluation. I was also involved as the chair of the HCHA, but also as a sector lead for a number of home health providers in the first care and support worker claim that was raised. There were 3 claims raised eventually, and that just caused a lot of confusion, having 3 claims raised. And we actually understood that that first claim was going to be a representative claim and do the work for the whole sector. Despite the significant sacrifice and strain on our organisations due to the work involved, we committed to the work. The group of us in the first 15, we committed to that work with the belief that it would benefit the entire sector and lead to worthwhile positive outcomes. And we thought all the way along, as we were engaging with government, that this is where we're going. We're going to achieve something amazing for our support workers who we had seen being undervalued year after year after year. So in 2021, we actually started talking to government about it when we saw the legislation, the 2017 legislation ending. And at that point, the providers thought the best way forward is actually just an extension and resetting of the current legislation, because that seems like an easy process. Well, we found out soon enough that that wasn't actually the intention. And by July, we were into a full pay equity claims process with 15 providers. There was some funding available to resource some of the process, but as I said, all of the providers put in significant resource to try and manage this claim process. What was really complicated about this process was that we were simultaneously trying to persuade officials about the claim's merits and the undervaluation to secure funding before we could actually begin negotiation. Because if we began negotiation without knowing what funding we had, then we could have a serious risk on ourselves if the funder said, no, we don't actually agree, which is actually where we were getting to anyway. We did a lot of meetings with government officials. We provided a lot of data over a period, and we got to a point where we thought we'd had a lot of agreement by the funders until they all of a sudden decided that no, they didn't agree with all of the work we've done and that they had signed off in the past, or we believe they'd signed off, and they decided that the work needed to be reviewed, which set us back. In 2023, we had an in-principle proposal. But the problem with that in-principle proposal that we got from government is it wasn't a sector-wide proposal. And we obviously, as providers, didn't really want that, because we want a sector solution. And that is a bit of a problem. Also, the proposed funding didn't actually match the undervaluation that we had calculated. So that was a secondary problem. In the end, we did work on an in-principle agreement on remuneration only, on a without prejudice basis, because we had a request from the Minister of Health at the time. There was multiple caveats, but in the end, we got to a general election in October 2023, and the process went into a pause mode for a while. We waited updated guidance from officials and from the national-led government, but no guidance was provided, and so we weren't sure where we were standing. A bit later on, around June, I think it was, we actually started, so in June 2024, sorry, I'll go back a bit, May 2024, we were assured that there was money there for pay equity, for settling a pay equity settlement. That came in the budget announcements. In June, we started talking about employee data, provider employee data, and government asked us for a large amount of data. We put a lot of work into that. All of the providers put a lot of work into providing data. This was in 2024, and we provided that by October 2024. By late 2024, Mark Powell, who was the official we were working with, he advised that his team was delayed, and we were expecting to complete data analysis in February 2025. 2005. And we'd already had a letter from Ms. Apa, who encouraged the providers, the employers, to continue working with Health New Zealand to provide the required data. In February of this year, there was a meeting held with employer representatives and Mark Howell and his team, and it was confirmed to us that the data collection process was completed and that Health New Zealand were developing options for a cabinet paper for government, and that we would expect to hear more back by March 2025. A cabinet paper would be in front of cabinet with a whole lot of options. Now, we weren't told what those options would look like. We said, can we help you with those options? And we were told, no, that is government's job to do that.
Sorry, Murray, can I just intervene there? And it's not timing, but I wanted to make sure I got this right. When was that meeting that you were told that the data was completed and that they were preparing a cabinet paper?
That was 19th of February 2025.
Good grief. Oh, sorry. Just taking into account what was already now known.
Yes,
that's a very interesting date. Thank you.
That's really concerning for us, actually. We know what happened then. Eventually, the legislation was changed. I was actually meeting with employee representatives at the time that the legislation was changed. Vision West employees. Our employees were so upset by it. They were in tears. They felt they'd been led up the garden path and they felt undervalued for the work that they do. They told me that employers and the government had promised that patients in this process would lead to recognition of their vital role of supporting disabled people and older people to live safely and independently. And that they knew that they were saving taxpayer money by doing that and keeping people out of hospitals. They talked to me about, what does this mean as a career? Some of them talked to me that they were actually now actively looking at changing careers because they couldn't see that they felt that they could never be valued in this workforce. And these are very well-trained people who are saving the lives of people every day. When I talk with other employers, people have voiced to me how incredibly sad they are that there is no outcome at this point. Now, when there is parity in the sector, we've now got providers competing against each other, and that's becoming more and more of a problem. We've got unions and in the workforce that playing each provider off against each other in a race to be able to capture workforce. And I've seen providers do what is unsustainable rate increases greater than their funding increases. And this doesn't bode well for the sustainability of our sector. I'm very scared for the future of what our sector looks like. I'll just hand over to Lisa to end our submission. Thank you for your time.
Thank you.
Thank you, Murray. Yeah, it's very sobering. And yes, I'll just finish off what I was wanting to say, but I think that obviously the challenges are extreme and concerning for the future. So the impact of the repeal is wide-reaching. It devalues essential care work. It erodes trust and goodwill in a sector that is already stretched extremely thin. It creates fragmentation and competition and unsustainability. It worsens recruitment and retention, especially in the high-need areas or rural areas. It widens the gender and the ethnic pay gaps, particularly for Māori and Pacifica women. It risks sustainability, as we said before, but it could lead to closures and job losses in the very communities we are aiming to support. It undermines Te Tiriti o Waitangi commitments and the principles of equity. And our recommendations, we urge the committee to consider these recommendations is really how can we move forward? We would look at developing a simplified, evidence-based funding model that's clear and sustainable, that will ensure pay equity without compromising service sustainability. It would be a sector-wide solution like the one previously proposed that Murray has just explained, and it would offer a practical path forward. It would ensure genuine consultation, authentic consultation and engagement with all affected parties and for any future legislative changes. support a tripartite review of the current workforce strategy or the not existent workforce strategy, with a focus on community-based care and not just residential settings. Avoid repeating the overly complex processes of past claims, make the process simpler, easier, smoother and faster. HCHA alone has put, there's $500,000, my time, 3/4 of my time. It's unsustainable to repeat that. A streamlined approach that can offer solutions, but without the unnecessary burden on hundreds and hundreds of employers. And address this growing pay gap that we have, which is between Health New Zealand funded staff and government funded sector workers and community-based workers. And we would need to look at a legislative safeguard in order to prevent further disparity, because the lessons from 2017 is that it was eroded over time because there was no maintenance or foresight around that. So in closing, pay equity is not just about fairness, it's about sustainability, dignity and justice. The home and community workforce is the heart of our care system, and they deserve to be visible, valued and respected. HCHA is committed to working in partnership to ensure that our essential workforce is supported so that they can continue their amazing work supporting others. Kia ora, thank you.
Kia ora, thank you so much. I've written down your words that they are the heart of our care system. They need to be visible, valued and protected. I just think that's a very powerful statement. I've got Jackie Blue, Ria Bond and Steve Chadwick.
Thank you so much for a compelling submission. 27.5 million hours of care per year, that's highly significant. And now with the legislation, it's completely destabilised the workforce. And as you pointed out, the competition over the workers. I was going to ask about resources. You've actually mentioned that, $500,000. What I would like to ask is, you represent 50 home-based support providers. Have any of them given you information that they may have to close their doors because they cannot sustain their work with workers?
There's growing concern around that. We haven't got evidence of someone closing immediately, but we've got extreme pressure and concern and threat. It's something we were just talking about. And just to go back to the resources, sorry, Jackie, but the $500,000 was just for HCHA alone, just for my team. So it's actually, I think it was 2 million that I worked out, and I think that's an underestimation.
Wow.
It's ridiculous.
Can I add a little bit more to that? So the providers in the first group of 15, we had a number of us were spending half our time on pay equity over a multiple year period. And that's a significant cost there's lost opportunity cost for community providers such as Vision West, just speaking of that, but also the group of us trying to work through these challenges, redo things. There was a massive cost. Well in the millions will have been spent across all of the providers just in the first claim.
Yeah, and then we've had the other claims as well. So as a peak body, we were working across all the claims just to hold everybody together, really. And the 4 peak bodies were involved. So all of the time multiplied by 4 plus all of the employers to lead to nothing. And that wastage and cost, I think, is something to really be reflected upon, because if that had been paid to improve the wages right from the beginning, then we wouldn't be having this situation right now. And just to go back, Steve, sorry, just for your the threat, I think just to say, we're looking at 1% margins for a lot of our providers. We had a 0% increase from disability last year, and a very low, they're talking about 2% this time. It's very, very concerning, because there isn't just the repeal of the Act. I think it's the lack of care for the sector itself. So where we go from here looks very dire.
It's interesting. I'll just chip in with, reflecting on that date, the 19th of February, when you were told that Health New Zealand was now going to set, having all of the data completed, they would start a cabinet paper with options to take to cabinet. The cabinet paper that was being prepared at that time was the one to repeal the Act. And it just, what I guess my frustration is that when you as an employer are dealing with your employees, you are required to act in good faith. But when the funding is dependent on the government, suddenly it loses its obligation to act in good faith. I just find that hard to accept. So thank you for really focusing on that issue. Sorry, I haven't really got a question. I'm just furious. Ria, over to you for a question.
Kia ora, Lisa and Murray. Thank you so much for your submission. I'm looking at point 6 of your submission, where you outline a range of systemic risk. And what I'm seeing in there is the, an exodus of your workforce, and also the poaching from government into the community-based sector. Do you have numbers around that risk that the committee could have a look at, if you could send it through to us?
I think one useful number is just the turnover rate between us, our sector, and healthcare assistants in Te Whatu Ora.
Yep.
So in meetings with Margiapa, we told them we've got a 20 to 25% turnover rate in our sector, and some providers are higher, whereas they had a turnover rate well below 10%. It was sort of in the 2 to 5% turnover. That was the figure that was told to us. And that would be directly related to pay, actually, pay and conditions. And when we are funded for essentially the bare minimum, there's not much we can do.
I think if you think about the timing of that, it would be heading in the wrong direction now. So I think that differential will increase.
Yeah, no, that's good. Thank you so much.
I think it would be useful for us as a committee to get the turnover rates, or the turnover rates for Health NZ as well. So
yes,
that would be very helpful comparison. Steve Chadwick.
Thank you, Lisa and Murray, for the enormous amount.
Legislation without notice, in urgency, retrospectively, to stop these 33 cases for pay equity proceeding for low-paid women workers. I don't accept the amended, watered-down version, which will not be equal pay as originally envisaged, and I think it will continue to be a running sore if it's not fixed. I would like to talk about two things: the notional male rate and the butchers in a dispute we had for meat packers. We created a notional male rate to achieve equal pay for a section of our union membership. It was based on a labourer's actual wage, which reflected what we considered to that employers would have to pay should a man apply for a meat packer's job in a supermarket. The people in packing meat in supermarkets were solely women employees. And we took into account the same or similar skills, effort, and responsibility needed to undertake the job had one of these men applied for it. Because most pay rates at that time in the Wellington area in the 1970s were far above the legal minimum wages contained in national awards, in nearly every industry, employers paid above this rate, and that was known as ruling rates. And it was this environment that meat packers wanted a pay increase, because their pay, with very few exceptions, was paid the minimum legal minimum and the national award for meat packers, while their colleagues in the same butchers departments were paid above the national minimum of some considerable amount. There was no male rate of pay in the award for meat packers. It was just one rate. It was around about $65 a week. So the second thing I want to talk about was what happened. The union met with the employers of meat packers in supermarkets in the Wellington region and asked to negotiate and get an agreement on a ruling rate pay agreement for meat packers. And that would reflect what the level of wages were, the actual level of wages were for other workers in the region. The butchers supported the meat packers in their pay claim. And while they were at their regular stop work meetings during this 14-month dispute, they refused to pack meat. And the same happened when the woman went out on strike for 2 or 3 days at a time, quite regularly, to press their claim. The butchers supported them. Now, some butchers had daughters or wives or neighbours that they wanted to support. Others knew of many other cases in other industries where women were low paid and their pay needed increasing. And without exception, the butchers, when we met with them on a number of occasions, with the meat packers or mostly without them, unanimously supported their claim. Importantly, they weren't threatened by the prospect of these workers getting a reasonable increase in pay. And they never once wavered in their support to their female colleagues. So what that showed us is that given the unfairness of what was happening, if you scratch the surface, New Zealanders will react to what's unfair, and that's exactly what happened in this case. And as I've said in my submission, we did have the support of other unions, but you may want to ask questions about that later. So I'll leave it at that, and you may have some questions.
Thank you very much, Graham. And I was really pleased to read your submission and to read that story, because I discovered that when I was trying to put myself together a timeline of all the different elements that had led to the pay equity stuff that we're sort of talking about today. And so to have, somebody who was directly involved in the establishment of a notional male pay rate, which just sort of seems archaic now, but it was a mechanism to actually meet the true objective of the legislation, which was equal pay for work of equal value. Jackie and then Lynn.
Graham, I just for the purposes, I'll let the committee know that I sent a question through to Graham via our committee clerk, because I wanted Graham a chance to have a think about it. As a former parliamentarian, you understand the machinery of government and how it all works, and I would appreciate your thoughts on this hypothetical situation. This is the situation, it's hypothetical. As the government heads into election year, its regular focus groups and polling show that the Equal Pay Amendment Act 25 is deeply unpopular and costing votes. They need to save face while being all pragmatic and seem to be taking action short of repealing the act. What would be some sensible first steps they could take?
Well, I've thought about this question because having spent a lifetime in the labour movement, working for low-paid workers and then legislating for them once I was in Parliament, from that experience, it's clear to me that when certain things happen in society, there's an inevitable outcome. And I think this issue has an inevitable outcome. First of all, equal pay is not equal under the amended Act. So to call it equal pay or pay equity is a contradiction in terms. There needs to be another term because it's certainly neither of those things. It's like believing you're half pregnant, and you will know that that's not possible. So the government have dug a big hole for themselves. They're good at featuring in photo opportunities about shovel-ready projects with photos that they want taken. But what they've been doing is digging a big hole. And now it's so large, I don't think it can be filled in before the election, short of reversing what they've done. Nothing less. Because it will not be equal pay under the new amendment, as envisaged by the original Act. You've got to put that in a wider context as well. There's been legislation passed from the first week of this Parliament, which has watered down health and safety for workers, taken away their other rights, trying to get overturned court decisions for Uber drivers who wanted to be employees, but the government said you're contractors when the courts proved that that wasn't the case. So you've got to put all that together, I think, when you're looking at this. But go back to your original question, is there anything anyone can do? Yes, there is. They'd have to reverse what they've done. And secondly, modify some of the other things that they've done that's been a slap in the face for workers.
Look, we'll leave it there because, and I know that Lynn's got her hand up, but we're moving on to take a very short break before we move on to the next submission. So, look, can I thank you, Graham? It's really good to have somebody that's got that extensive experience over such a long period of time, but actually can take us back to the very meaning of the legislation that was amended earlier this year. So, thank you very much for taking the time. It's good to see you.
Okay, pleasure.
Cheers. Thank you.
Bye now.
And if we as a committee could take a short break, we will reconvene at 10:33. That gives us 5 minutes to get a quick cup of tea. Thank you. Koto katoa. Welcome back to the People's Select Committee on Pay Equity. Our next submitter is the NZEI, Te Rui Aroa, and the submission will be presented by Yvette Taylor, Stephanie Mills and Kate Drury, with some of the union members, which I'll leave them to introduce. Could I hand over to you, please, now?
Okay, they need to get moved in.
Morena.
Morena.
Kia ora, I'm Stephanie Mills and I'm very happy to introduce Ali Kingy, who's one of our teacher aid members who works at Newton School in Auckland. She was involved in the pay equity negotiation team for teacher aides and has been a member leader since we initiated that first claim with Ministry of Education in 2016, a long time ago, and has been involved in the recent review process that was scrapped. And also Claire Forrest, a librarian at Raroa Intermediate in Wellington, who was also involved in the librarian pay equity settlement, which was also due for a review. So they'll both speak, and then Yvette will make some key points. In summary, we would like to focus on the scrapping of the review process, because this is a really important way in which pay equity is maintained. And with its loss, we've now got, as you know, the process of having to start a new claim, but having to wait 10 years. And there are some major issues also with the comparator changes in the amended Act, which will impact going forward on those claims that were settled. So we have some other fires, fish in the, what's the phrase? Kettles in the fire, and that we are pursuing through the Employment Relations Authority a claim that the employer still has an obligation to offer and afford employees pay equity. And we're also involved in the cross-union filing for a Bill of Rights claim, which is happening tomorrow. So I'll hand over now to Ali.
Morena te whānau, ko Ali Kingy tōku ingoa ko he kaiawhina tautoko. Ngā mihi nui mō tēnei kaupapa. Thank you everyone for making this happen when the government wasn't going to, because it needs to be done. Yeah, I'm a teacher aide. As you can see, I'm in a funny little back room at school with all my bits and pieces around me. The reason our work is so important is because it means our most vulnerable tamariki get to come to school, get to be part of the crew, get to join in with things they wouldn't be able to otherwise, and that their teachers have the support they need so that they can access curriculum and everything else. I love doing what I'm doing. I never chose to become a teacher because I feel that this work is so important. So as you know, we thought we'd do something about it because we'd come from historically being this sort of mother help role where we came and mixed up some paint and did some little jobs at school, to becoming this highly specialised workforce that the things we do in school are things that teachers can't do. A lot of it is medical support, high behavioural needs support, all of those things. So we thought that had some value. So we took a pay equity claim and we jolly well won it. It took us a while. It took us some years to do it. We had to find an assessment tool in the world that would be fit for purposes and then make it work in a treaty-based country. And then we had to talk about comparators for many months until we got to a point that we could look at our claim. And we won. And we won fair and square. And it was awesome in November 2020. It was amazing. And the things I love are the women who were on our Facebook page. And it was the woman who, for the first time ever, put a picture of her brand new blue shiny lawnmower that she'd bought new from a shop, because she'd always had tacked together bits of lawnmowers and she was really stoked about that. It was the woman who could have her grandchildren over in the holidays because she hadn't been able to beforehand because she didn't have money for extra food for them. And most of all, it was the women who could drop their second jobs and be with their families. And that was the biggest deal for all of us, was the women who didn't do this for the love of it and then have to go and do another 10, 20 hours a week on top of it just to make ends meet. And that was the difference that pay equity meant for teacher aides. And then eventually, as we settled all the other claims, for all support staff in schools. And that's huge and that's meaningful and it really, really mattered. And it meant people could stay being support staff in schools and didn't leave to go and do jobs that paid better. And that was the crucial thing for our tamariki. And then came that fateful day in Blimmin May. And I remember it so clearly. And I remember it weirdly quite physically because I was having my mandated 10-minute break in the morning. And as you do, you pull up your phone, pulled up my phone and went, what the heck? And realized that something was going on with pay equity. And I had to take myself away from children because of the feeling that I was having. And then one gorgeous little person came around the corner, saw my face and said, Fire, are you okay? Your face looks really angered. And I said, I am angry, darling, I'm not with you. Because they could see from looking at me what had happened. And it wasn't until the hours and the days and the weeks rolled on that we realized the enormity of what was happening and realized that we weren't going to have any recourse. So at the beginning, the teacher aid settlement that we took, because it was the biggest amount of members, we built into it a review clause because we knew how important that was going to be. We didn't want a one-off and like, woohoo, what a great day, and then it all drifts away again. The review clause is gone. We're looking at now, in some spaces, a 17% difference between us and the male-dominated comparators. Unfortunately, that day when we won and we had our back pay in the bank and it was so good, and I was walking around the supermarket and I was talking to someone on the radio and I was buying all these glamorous foods from the supermarket, like the good cheese and everything. Wasn't until I got home I realised I hadn't bought pepper or toilet paper, but that didn't matter because this was the moment. Little did we know that was going to be a one-off. Little did we know that was it. That was our big hurrah, and that we're just slipping back again, which means people are going to have to take up those second jobs again, which means that people are going to leave being support staff in schools again to go and do jobs that can buy them butter. So we naively were asking the minister, hey, we built in the review. It's time to have a look at it. Have you got a minute to take a look at it? They were never going to. They had a plan all along, and that's the bit that really stings the most.
Yeah,
is that they were plotting, and they gave it a little project name because it was really cool, and that the Prime Minister knew all about it and signed off on it. And that's the bit that really guts us, because support staff in schools don't just benefit the children that they're working directly with, they benefit the whole school, the whole class, and everybody. And to say that we're not valuable and we're not worth it that's the most yucky bit. So Jackie, I see you have a question.
No, I'll take questions at the end after the two of you have presented. So,
cool. Yeah, I'll just finish with, like, we absolutely cannot allow all the women who came before us and all the recent work that we've just done with pay equity for all of these people, not just us, but for all our sisters and all of the workforces, to just continue to be underpaid and undervalued. Ngā mihi nui.
Thank you. That's a very powerful, well, really a presentation of how you learned it on the day. And I think that's going to stick with me for quite a while. So we're moving on to Claire, are we? Yeah, thank you.
Thank you, Ellie. Kia ora, ko Claire Forrest, Toku Ingawa. I apologise if there are noises in the background. I am in a school, and there are kids here, and they are loud. So and the bell might go. So I'm preparing for that. I'm a librarian at Raro Intermediate in Te Whanganui, Tara, and was one of the, like Ellie, one of the many people involved in the successful support staff pay equity claims completed under the last government. This included teacher aides, administration staff, school librarians and science technicians. Many people far better qualified and more eloquent than I have talked to you about how dishonourable, disappointing and unfair the changes are that this government has made to the Equal Pay Act. How much they disadvantage women who deserve to be paid fairly and equally for the work they do. How it feels like we have been robbed of our rights. So I won't say that. Instead, I want to tell you the story of what it was like to work with a small, dedicated group of school support staff with the support of our NZEI Te Reo experts, combining with the Ministry of Education's pay equity team, because they existed, spending years and endless amounts of energy interviewing colleagues and male comparators around the motu, all the time with the weight of our people's expectations and hope to drive us through the delays of COVID, the frustrations of bureaucracy, and the lack of understanding about what pay equity actually was. I learned that women in schools work hard, are dedicated despite often difficult conditions and low pay, and they make a significant difference to their school communities and are proud of that mahi. That schools couldn't run without these support staff contributing to this complicated ecosystem. I learned that not many people outside of their roles understood the complexities, responsibilities, skills and demands needed to do their jobs well, and that the pay equity process would help them feel seen and valued, that they deserve this as much as they deserve to be paid a wage that was commensurate with their efforts and talents, no matter their gender. We achieved all of this, getting significant pay corrections, over 30% for some. I remember how proud and emotional I felt at the end of the journey, like you, Ali. It felt like we had moved the scales for women a little in the right direction. It felt hopeful and it felt right. It made a difference in our lives. Obviously, we had been underpaid for far too long, and this result was a great cause for celebration. Sadly, after only a few years, support staff are already falling behind the male comparators used for this pay equity, and our ability to review and fix this blatant sexism has been taken from us with the changes made to the Equal Pay Act. I know that we are in a better position than those whose claims have been stopped in their tracks, but it doesn't feel like we are the lucky ones. It feels like we have been abandoned and disrespected. We would like a government that respects all educators, honours its agreements, and ensures all of us have secure jobs and fair pay. Ngā mihi.
Thank
Would
you.
you like to speak quickly, or are there questions?
Yeah, I'm keen to make sure the committee gets the chance to ask questions that they'd like to. So maybe we do that, but I'm also happy to make any further points if needed.
Well, yeah, maybe that some of the questions will invite you into the fray. So thank you, Ali and Claire, and I'll ask Lynn Pillay and Jackie Blue. Lynn, can you put your sound on, please? Sorry, I hadn't noticed. I saw your lips were moving, but not much else.
Sorry, thank you very much, and I apologise for that, and congratulations on your settlement. I was particularly interested, Ali, and you talked about the review and that, you know, that your understanding that it was all going ahead still and the blindsided, and I really feel your pain. But we have had previous submissions that have talked about that process. There seems to be two parallel processes, the as you described it, Ali, the Cool Project 10, and then what the officials were saying to the organisations and people who were working on claims. So my question is that with NZEI, have you ever experienced anything like this before? When you're not just in terms of pay equity, when you're dealing with government and you're actually getting encouragement to go down a stream of work, whilst there is clearly work underway, that is completely counteractive to that.
Thank you. I'm going to throw over to Steph because I just want to make sure, has there ever been? I can't remember it in my lifetime, but I'll just throw over to Steph to be double sure.
Thank you.
No, I think this is unique in that it happened under urgency. There was no consultation, certainly not with us as the union party, and we've always had pretty collaborative relationships with the Ministry of Education in the pay equity space, stemming from a shared understanding that this would be good for women working in education and ultimately good for kids. So it was a huge shock, and I think although we had sensed that there was definite resistance, you know, from the government in terms of been concerned about the costs of settlements. There was no indication that they were going to pull the plug completely.
Right. Thank you.
Look, I'm going to let Jackie ask a question in a second because I'm just taking the chair's privilege of asking a question myself, because I think what's been most valuable about your submission is that there is a narrative that everyone who had their pay equity claims settled before the law was changed were unaffected by the law change. And what you have demonstrated is a very clear and explicit effect that has meant that a review entered into in good faith, a review provision has actually been completely wiped out by the Equal Pay Amendment. Now, that must raise good faith issues as well, because here you are dealing with your employer who essentially has gone to cabinet with a decision to overturn that provision as part of the amendment. I mean, I'm just interested in this concept of good faith and where does it sit in terms of what happened?
Well, I think Ali's spoken to the emotional reaction, but yeah, I think the retrospective aspect of this is hugely challenging because, and that's why we are going forward in the Employment Relations Authority, because our reading of the Act is that regardless of reviews or claims, the Act requires employers to offer and afford employees pay equity, equal pay. And so I think there is more water to go under the bridge on this, but we are determined that Kairahi Te Reo, who got, settlements of upward of 70% increases, teacher aides, our biggest single support staff workforce, librarians, therapists, science techs. I mean, it's absolutely gutting to not have a remedy obvious to this, and that's why we will be exploring those legal options, and of course trying to ensure that all government MPs understand how angry women are about this having happened, first of all, and secondly being done in bad faith and under the cover of urgency, without any consultation.
Jackie.
Yep, thank you so much. It is very hard to challenge the government legally, but one option is that your Māori members are taking complaint to the Waitangi Tribunal on the basis that the law breaches treaty principles. Is that something you might consider?
We have a claim in under the Education Services kaupapa inquiry, and it feels like we are doing quite a lot of legal action at the moment, also with the defunding of resource teachers of Māori, who obviously are predominantly female as well. So I think there's a really strong crossover in our minds in terms of the attacks on Māori and the attacks on women, but also that the biggest gender pay gaps in our workforces were for Pacifica and Māori women. So that's why the Kairahi settlement was so important. We'll continue to pursue all the angles we can. We're not going to give up. We've invested hugely as a union in this. I'm not really talking about the financial aspect, although that's been significant, but members' time and energy and passion and commitment, and we're not giving up easily.
And the last question to you, Dame Marilyn.
Thank you very much. There's two really key things that I've taken from this submission, and those are your rebuttals of government arguments. The first being that, whenever the government talks about employers, overwhelmingly they're talking about themselves, so they're talking to themselves. And when they say so, there was an incentive for employers to be very flexible and generous with respect to the settlements, because the government was going to in that funded sector. I think that was really compelling in your submission to me, and the other part is where you talk about at all of these different moments if, for example, the government had found the comparators to be unacceptable, etc., that they had every opportunity, right? And am I to understand they never exercised that?
So in relation to the teacher claim, no, they didn't exercise that. In relation to the teacher aid review, which was the first major review under the whole scheme of the Act, they had not sought that until very, very recently, which was when we ended up agreeing to go to mediation, because, or rather we sought to get movement because they had got stuck on the idea that, in fact, equity had been maintained. And even though there was, as Ali pointed out, up to a 17% difference in pay between the male comparator group from the original settlement and now, they had got very stuck on, rather than looking at whether there was discrimination based on sex, they got quite stuck on market factors and whether in fact it was market factors that was contributing to this. Now this is, quite nonsense really, when the government has monopsony power as the funder and the employer, as you pointed out. And so I think a lot of the narrative from government about what employers thought and did are entirely self-serving. I mean, we know that the Ministry of Education, as I said, had been a committed partner in this process. So I think that's also been extremely disappointing. And we do want to really test, I guess, the idea that employers don't care about it, because we think they do. And we think, the Crown, as the employer in this situation of teacher aides, indirectly through school boards, has that obligation to continue to pay equity, even if we cannot seek a remedy for it.
Thanks, Stephanie. What was the date that you went to mediation, that you felt a need to go to mediation? Sort of roundabout?
I'm just trying. I am
Look,
picking.
Perhaps you could just send us a paragraph on that, because I think these dates are quite significant when it comes to the timing of when certain decisions were made, which have only been daylighted after the fact. So it will be very useful for us to have it in writing, the exact tracking of the review process and the mediation.
Yes, thank you. That'd be great.
Thank you.
Happy to provide that.
Look, thank you very much for the submission. As I say, that's going to stay with me for a while. It's very compelling to hear the story about how people hear the news. It's going to stick in my mind, certainly. So thank you very much for taking the time out of your very busy days to make a submission to this People's Select Committee. Thank you. And if we could now move on to Workers First, who were the union, as we know, who raised the vet nurses claim, the first one in the private sector. So if I could hand over to, and I think it's Jasmine Searle that we're going to hear from. Hello, Jasmine.
Hello.
We've read your submission, and if you could just leave a bit of time at the end for questioning. Obviously, you've got the time allocated to you, not the physical time, but the actual minutes of time. So please take your time.
No worries. So my name is Jasmine. I am a veterinary nurse and have been working as one for 8 years. I've been a part of Workers First Union and our pay equity claim for the last 5 years. And predominantly the reason why I'm here is to speak on behalf of veterinary nurses across Aotearoa whose work is being systemically undervalued despite our skill, our dedication, and the risks that we face every day. So we started this union and this pay equity claim just as a group of nurses with sort of hope and drive to see a better future for the industry. We were set to be New Zealand's first private sort of large-scale pay equity claim, because we span sort of across multiple private employers. But with the change to legislation, 5 years worth of work, research, negotiations was all thrown out under urgency. I'll give you some quick key facts about our industry before I sort of go into what being a vet nurse entails and why this pay equity claim is so important to us. So veterinary nursing is a 98% female workforce. Our entry-level qualifications start at a level 7 diploma, so 2 years worth of study, and go all the way up to a master's level degree. We also have a growing number of veterinary nurses who are holding specialist memberships. Now these are ones that they've spent years and years studying for and have to pass board exams, so very qualified people. As of mid-June 2024, the average wage for a diploma qualified vet nurse was $26 an hour. The living wage at this time was $27.80. And then 41% of veterinary nurses leave the industry within 5 years, and 74% of vet nurses don't expect to make it till retirement in this job. So what do we actually do as veterinary nurses? Well, I'm sure most people know of veterinary nurses. It's not a very well understood role. So our veterinary nurses are the backbone of every clinic, whether it's a specialist hospital, an urban practice, or a rural mixed animal practice. If you don't have nurses, clinics cannot operate. We're responsible for managing reception, client communications, performing consults, patient triage, drawing blood, placing IV lines, preparing patients for surgery, inducing, intubating patients for anesthesia, monitoring and leading anesthesia, scrubbing into surgeries to assist the vet, performing diagnostic imaging such as radiographs, ultrasounds. We're doing dental hygiene cleans and exams. We're managing medical complex cases, which is often including zoonotic diseases that pose a risk to our own health. And then, as everyone knows, we're there for start of life care and we're there for end of life care as well. This work is done around the clock. We're there after hours, on weekends, public holidays, and often in emergency settings where you're under immense pressure and emotional strain. We're also facing a significant amount of risk every day we come to work. For example, in my clinic, our health and safety team identified 55 hazards that we are subjected to on almost a daily basis. Some of these are obviously being attacked by our patients or our clients. We're exposed to carcinogenic chemicals, ranging from anesthetic gases all the way to chemotherapy drugs. We're exposed to radiation on a daily basis. And then we're also exposed, as I mentioned, to zoonotic diseases, so diseases that our patients carry that can then be passed on to us, which can range from GP visits to being able to hospitalize us and have serious implications on our health. We also face mental health risks. This industry puts you in emotionally distressing situations, and that takes a massive everyone in it. Despite all these risks and responsibilities, most of us are being paid less than the living wage. Our veterinary nurses are often living paycheck to paycheck, and many are working 2 jobs to get by. Currently, we have no way forward to fight for better pay. Under the previous pay equity framework, we had a path. It was going to be a challenging one. We'd already made a previous submission that we'd then had to remove, but we had a path. Under this new legislation that requires us to find a comparator workforce, ideally a male-dominated one, doing a similar work within the same employer or sector, it's impossible for us. We don't have any male-dominated comparators in our sector that performs work of equal value or complexity. So we've been left with no viable pathway to pay equity. The only other option obviously is the multi-employer bargain, where employers can just simply opt out. And if employers were going to pay us better wages, they would have done that by now. Doing that is not something that's viable for us. After being in this industry for as long as I have, I am constantly second-guessing why I've stayed. The Workers' First Union asked to share a personal story or experience, but while I was preparing for this, I sort of struggled to pick one. Over the last 8 years, I have lots of stories of new life and heartwarming times, seeing a new family member, the joy in people's faces, but for every one of those, I will have double the amount of stories of immense grief, burnout, and traumatic situations, countless shifts lasting 10, 12 hours fighting for patients to see them fading away. Nothing you can do. but ultimately being there to hold their hand as the owners say goodbye, and then you just continue. Life is normal. You have to leave that situation and continue working. You spend hours in surgery just to not have a positive result at the end. In the last month, for me in my workplace, I have had 2 of my colleagues be diagnosed with PTSD as a result of working in this industry. This industry just demands everything from you, and I think the least that we could do is just have the ability to ask to be paid fairly. The implications of this change in legislation has been intense. I mean, the clinic that I work at, I do all the recruitment, and we're struggling. As I said, that everyone leaves. Percentage of nurses leave after 5 years. Trying to find senior staff members, they don't exist. So every clinic that I am sort of responsible for is dwindling. We just don't have staff. We can't find them. You put countless adverts up, and you can't get nurses because they've left the industry, or your employer is not willing to pay a fair wage. So us who stay in the industry are stuck like this until hopefully we get a change in legislation and we can restart our fight. That's more or less what I had prepared today, but I'm happy to take any questions on anything in the industry, our pay equity claim, all of these things.
Well, thank you very much. I do. I'm very grateful that the union asked you to present a personal story, because sometimes these are the most compelling ways that we can understand the impact of decisions that have been made. And as a former owner of a beloved cat who had to be given assisted passage to cat heaven, as we described it at the time, I know that the support that workers such as yourself give is invaluable. So I really understand the presentation that you've made. So thank you for all that you do, and thank you for presenting to us. Could I ask Sue Bradford to follow up with a question, and Jackie Blue after that?
Kia ora, Jasmine. Thanks very much to you and Workers First for making this submission, because you are, both to get the perspective from vet nurses, but also because, as far as I know, you are the only private sector pay equity claim that had started prior to the government's dreadful decision. Can I just ask a couple of things? First of all, during that 5 years of working on the pay equity claim between the union and employers, do you have any overall sense, was some of those private sector employers sympathetic to what you were doing? Like, how much did they engage? Was there at least some sympathy from some of them?
So as I briefly mentioned, we did do a submission or started a claim a couple of years ago, and that was not met with kindness. They very quickly, as far as I was aware, formed a collective sort of group and were not, didn't want to engage. I believe in this one, the employers were more willing to engage, but were still going through a representative. But that's pretty much as far as we've got on this claim, is nominated a representative, and I believe that Cheryl, who was heading the claim at the time, was due to have a meeting with him days after they made the changes. We did hear from an employer directly afterwards to say, oh, it's such a shame your claim has been shut down. This is a multi clinic employer who is based overseas, and they got in touch afterwards to say it's a shame your claim has been shut down. We were really hoping for it to be successful, but this is an employer who continues to pay under the living wage themselves. So I think
so. Overall, the assessment is that without the pay equity process and legislation, there's no way forward apart from your normal bargaining.
Yeah, exactly.
Oh, kia ora, Jasmine. And just very quickly, are you any other claims that either your own union or other private sector unions had started to think about putting together before May?
I was not aware of any other private claims being made. As far as I'm aware, we are the first to do it.
Kia ora, thank you very much.
Kia ora, thank you. Sorry, I'm gonna take Ria because I don't think Ria's had very many
Sorry.
questions so far. So thank you, Ria.
Oh, thank you. Kia ora, Jasmine. Your submission was very heartening, was very, very amazing in totality. But what I wanted to pick up on was in your oral submission, you talked about vet nursing mental health needs. You mentioned that you had 2 of your own team suffer from PTSD. Do you know, in terms of the sector, what that portion or percentage rate is on workers?
Not within vet nurses. So there's not many studies done or research being done on burnout rates or mental health within vet nurses. Definitely within vets. It's very commonly sort of known that vets have sort of one of the highest suicide rates as an industry, as a profession. And yeah, across sort of my 8 years of working, mental health within vet nurses is something that is appalling. We work, as you said, in very distressing situations, and you're not given breaks. You can work those full shifts. I think of many times. There's a time that comes directly to mind a few years ago where we did a surgery that lasted hours, and it was very traumatic for everyone who worked it. And afterwards, we still had to clean the clinic. We still have to close and do banking and carry on as normal when you're just heartbroken and you're devastated. You've had to go through this, but you still have to show up the next day. And we have mental health resources in place, but they're not. It's sort of just your standard. You can contact EAP. We are lucky to be part of a company that does have a focus on mental health. When traumatic events do happen, we will get in a sort of grief or trauma counsellor to come in and have sessions. But this would be my third company that I've worked for, and the first 2. It's very common and laughed about in this industry. If something happens, your boss will buy you pizza. You'll get a pizza party. That's what you'll get. You won't get anything else. You're going to get my last clinic, hot chips. You work ridiculous hours, something happens, someone tries to attack you, a patient tries to attack you, hot chips.
Gosh. I'm speechless, but thank you so much for your submission.
Thank you.
Yes, thank you very much, Jasmine. And Jackie, did you have or was that covered?
No, I just wanted, no, it might fine. I can put a question through the clerk. Thank you.
That's great. Okay, thank you very much. Thank you, Jasmine. Really appreciate you turning up and sharing your own personal experiences, but also the experiences of others who perhaps haven't been able to speak for themselves. So thank you very much.
Thank you.
Now we move on to Carol Hamilton. And is Carol there?
Good morning.
Good morning. Yes, we've read your submissions. So if you'd like to speak to the main points that you'd like to leave with us and leave some time for questions. Thank you.
Thank you. My name is Carol Hamilton. I'm submitting as a community individual, actually, but I have connections to 2 or 3 ad hoc groups, women's community groups who are concerned about recent erosions in the rights of women in New Zealand and elsewhere. And I'd like to thank the committee for giving me the opportunity to share my response to Pay Equity Amendment Act 2025, because I'm a wee bit away from the centre of it. So I hope I'm not speaking too far away from the main issues that people have been raising. I've listened to many of the thoughtful and very moving submissions. Jasmine's in particular struck me this morning. And I agree with an awful lot of what's been said. The aim of my submission was to offer a kind of interim solution that immediately increased the remuneration of 2 groups of predominantly female workers affected by the amendment, primary school teachers and aged care and support workers. And at the time I thought, well, if immediate pay rise around the average gap between male and female take-home pay in 2025 is a stopgap solution, around about 10%. Now, I understand Stats New Zealand most recent figure is 5%. The average gap in wages, you'll be interested to know, but I'm sticking to the earlier figure anyway. The rationale for this proposal was that both groups comfortably meet the new 70% female worker overtime threshold, primary school teachers at 85%, and aged care direct care support workers at 90.5%. And both occupations are vital to the ongoing well-being of two vulnerable groups, young and old community members, and I think everybody could agree on that. The groups I mention here are those with the working conditions I know most about, so they're my principal focus here. I've taught at primary, secondary and tertiary levels in New Zealand, and I've worked with support workers and carers as a trainer, an academic and a researcher. At a personal level, I've never had any kind of political ambition at all. Yet in 2023, I joined the Women's Rights Party. Jill Ovens, the founder of the party and absolutely passionate about equal pay and convinced about the use of a suitable comparator group method to address differences in pay attributed to sex-based undervaluation, the idea of equal pay for work of equal value. Many, many conversations with her and others in the party and elsewhere later. I'm still not convinced the comparative process route represents the best way forward for female workers. And that's partly why I'm making this submission here. And here's the reasons why. In early 1990, two women in the US published a book called Job Cues, Gender Cues. I read it in 1991 as part of a research for an article a colleague and I were writing for a policy journal. These researchers had tried to find out what was going on for girls who were leaving school and entering the workforce. Girls were achieving educational success in high numbers. How did that affect their job chances over time? And the one thing that the researchers found was that women at that time were likely to earn only 2/3 to 3/4 of the average male wage. We're talking about the late 1980s here. But they also found other things, and this is where I struggle with the comparative method to fix this problem, that they found that increasing numbers of women entering occupations that had been traditionally male occupations, they became less attractive to men and over time less attractive to women as well. And when women reach around 50% of employees in the occupation, other things begin to change. And it's not just becoming less attractive, the occupation begins to change. And when an entire occupation speciality reached around 80% female, men abandoned the specialities almost completely. So the occupation experienced not only a decline in worker remuneration overall, but a decline in job autonomy and status, a shift in the job content and practice from a masculine to a more feminine orientation in task and expectations. And the best example, and I've seen it over time, of these 2 points is the teaching profession, and in particular the primary teaching profession as an occupational speciality. In 1998, beginning primary teachers were earning overall 6% more than the average wage. By 2018, this group were earning overall 14% below the average wage, and females were edging towards 85% of employees. The profession had also experienced a significant drop in occupational status, difficulty in recruitment and retention, and an increase in ministry or government-led detailed curriculum content that teachers delivered rather than taught. So what really Reskin and Res were finding out was that any occupation where women are employed in increasing numbers will experience all these problems: decline in remuneration, job status and individual autonomy within the work environment. While variations in valuation will depend on how heavily associated with feminine attributes the occupations are, overall and over time, females as a group entering any employment area will contribute to this no-win position, no matter how many comparators are made. In my submission, I also suggest that the committee call for an immediate pay rise of around 10% for aged care and support workers. And I was very interested in Lisa and Murray's submission earlier on. My reason for the immediate pay rise for this group are that the majority of female aged care support workers in New Zealand in particular are between 50 and 64 years, and most of them are between 55 and 64 years. These women have been in the no-win position I outlined above for decades. The immediate concern is the recent rise in precarity and homelessness experienced by older women, especially those renting in the private sector. At the moment, a New Zealand woman will earn $880,000 less than a man over her lifetime. That's a loss of a potential up to $50 a week in income in retirement over a 20-year retirement period. And in 1990, Associate Professor Philip Bunkle pointed out that poverty is overwhelmingly a female problem. The positive in the submission, and this has been echoed by other submitters this morning, is what can be guaranteed is if the suggestion is taken up, it's safe to say that at least a percentage of any pay increase received by members of both groups would go straight back into supporting families and boosting local businesses, increasing community well-being and the local economies. And this point was made by Anna Gilling this morning. And I understand finally that NZDI and other unions are moving to file some sort of claim. I didn't quite finish looking at that. But the question that I'm asking is whether what they're doing now speeds up the possibility of real-time increases in remuneration and job status for workers in these two occupations. For me, the money and the status must be considered as inseparable. And I think that was something that Anna Gilling also brought up this morning. If you don't consider the two as inseparable, you are going to end up in a no-win position over time again. And I think that's come through this morning as well. So while highly paid lawyers are arguing the toss backwards and forwards in the High Court, the issues that have created the problem in the first place and that Riskin and Roos pointed out in 1991 don't get sorted through. And that's it.
I turned my audio off because there was a ambulance whizzing by the house. So that's an incredible submission, and the detail that you've gone into in terms of presenting both a historic lens, but also a way forward. I've just found it incredibly fascinating. Have we got any questions from the team? Jackie Blue?
Yeah, quick question. I don't know if you were listening to the veterinary nurses in the last time, I suspect you were, but in your table on page 4, you can now include veterinary nurses at 98% female workforce. You've got a table there with midwives, early childhood teachers. But
yeah. Sorry, Jackie, I was absolutely fascinated with Jasmine's, and again, over the years, I've followed Riskin and Roos's ideas because they just struck me. I was very new. I was actually only a master's student, but I got stuck into this women's employment. And of course, the veterinary area is one where the balance between male and female workers as veterinarians, as well as allied health, vet workers, has changed a lot. And there has been a fair bit of goings on. as women have entered that occupation in increasing numbers, and this is Reskin and Roos's point, you get to a particular kind of tipping point, and it's around the 50%. And you begin to see the occupation changing, the status of it changing, allied workers taking on a lot more responsibility, and by and large they're female, and of course they're not getting remunerated for it. Meanwhile, males don't want to take up those positions.
Thank you for your submission.
Yeah, and it's yeah. The other interesting one, of course, is parliamentarians. In our 2020 Parliament, 50% were women. So you can see all things starting to come in. You know, I'm just a citizen here now, and you know, I can say what I like, but it just struck me as very interesting that when parliamentarians became 50% of that workforce in the House, then we began to see some changes too for how women are perceived within New Zealand and within that environment as well.
Just out of interest, what is the current percentage of women in Parliament? Does anyone of the panel know that? Or do you know that?
I didn't look, Jackie. I think it's round about that, though. I don't think
it's still 50%. I know it was over 50% in the last Parliament. Wasn't sure about the current Parliament.
Yeah, it's knocking on that. And if Reskin and Roos are still right, we are looking, and I think maybe the Pay Equity Amendment Act itself has something to do with something here, but that's in the realms of speculation, and you know, talk for another time with all my friends who will disagree or agree with me heavily.
Thank you. Dame Marilyn.
Yeah, thank you, Carol. I'm looking at your page 6, and you're quoting from the Royal Commission of Inquiry in 1971, and then you've got a quote from Holland, who is a I think cabinet minister at the time, and this is one of the things, like in that 1972 Act, you've got Section 3.1, which is obviously about equal pay, applies to work either dominated by men or where neither male nor female predominate. And then you've got Section 3.1b that applies to work that is exclusively or predominantly performed by women. Now, I don't know if you know more about what's going on here, because even though the courts subsequently don't recognise B, exclusively or overwhelmingly performed by women, we're all old MPs, and we do know that you don't get to have Section 3.1a different from Section 3.1b unless people in the House understand that. Like, it would never have passed if it was not, if they weren't supposed to be different. Do you have any knowledge about that from the Royal Commission or from the debates in 1972?
No, I don't. I was on quite a steep learning curve catching up with how things had happened over time, and I just merely noted what I thought was interesting. And yes, so that's the long answer. The short answer is no, I don't.
I think we'll have to go and read the debates for 1972. Thank you.
I think that would be a very good idea. I'm sorry, Ria, but we're just going to move on to the next submitter. And look, thank you so much, Carol. I think you've piqued a lot of interest around the table. So really appreciate the time and effort that you've gone into.
You're grand. Thank you very much. Thank the committee.
Thank
you. And our next submitter is Bernard O'Shaughnessy. And is Bernard O'Shaughnessy there? It's probably Shaughnessy, actually, if I'm pronouncing it correctly.
Hello.
Hello.
Good morning.
Good morning.
I'm Bernard O'Shaughnessy. I'd like to speak to the committee, please.
Kia ora, that's us. We're here and we're ready and waiting. Thank you very much.
Thank you. I oppose the action taken by this extreme right-wing coalition government, the gaslighting and robbing of over 180,000 predominantly women workers. When a person is a new parent, you have to wipe and clean bottoms. It's unpaid work, but it's valued by the child and valuable for society. In working as a community support worker, I was cleaning and wiping adult bottoms. The pay was just the minimum. In being a grandparent, I've cleaned and wiped bottoms, unpaid, but value added and nurturing. In being with friends and family members needing assistance in old age or illness or dying, I've cleaned and wiped bottoms. In being in different hospice and hospital environments where a loved one is cared for before departure, I've seen the awesome care given by low-pay workers. I read in the paper that when the wealthy and the politicians are ill or dying, it's odds on that their bottoms will be cleaned and wiped by a low-paid worker. Now, with the passing of time, I can see I might need my bottom cleaned and wiped. I hope by then the low-paid workers are recognised, valued more, and given a pay increase. Nursing. We value nurses but underpay them. Under a Labour government, gains were made, but that was playing catch-up on the many previous years of underpay. Then there is nurses in medical centres and with GPs, where contract funding needs a better model to be fair. Then there is the aged care sector, where care staff are terribly underpaid, overworked and short-staffed, yet megabucks made for shareholders and commercial firms. Teaching. In being a teacher, encouraging young persons to learn how to learn, to support the progression of society. It's an extremely challenging, tough job, undervalued by the pay rates and immense new world pressures placed upon the workers. Only in recent years have basic reasonable pay rates come into play for teachers, but are so quickly being eroded, just like in decades past. Assistant teachers are so important, but also undervalued. Often in my classroom, I had individuals with special learning or physical needs. Often the support assistant would be in for a few hours or days. If the child's in a wheelchair for 24 hours of class contact, yet the assistant teacher is only getting 10 hours low pay work per week, how does the busy teacher cope? Or if the young child is not coping with trauma at home, be it poverty, overcrowding, or unemployment of their providers, teaching to learn, to hope and to aspire just goes out the window. Industrial relations, human resources. In being a human resources practitioner for 15 years for the employment in government, print, education, justice, math, DSIR, I managed conditions of employment issues across New Zealand. The public service and state sector staff has always been second fiddle to the sacred mythical cow of private enterprise. In monitoring horizontal and vertical pay relativities within the public sector in comparison to the private sector, the gaps show always the private sector being ahead in like-for-like work. Also disparity when like-for-like jobs are not identical on the surface, but drilling deeper, looking at similarities of responsibility, job pressure, expected outcomes, targets, timeframes, or financial requirements are in evidence. Who and how are decisions made? There's always a system, fair, but at many times unfair. The disparity is here now and measurable because the system has been unfair. With my time in human resources, I was also involved in 6 years in industrial relations. The employer, the government of the day, offers the minimum pay increase like 1% or even 0% now, and the employee seeks the maximum. Then the dance commences. The circus goes on, and it's seldom a win-win. My main submission tabled recognised that while the 3 odd bedfellows of the coalition have done this legally, but under urgency, shows they're lacking in principle and clearly have lost their moral compass. Over 100,000 workers in many diverse but important jobs wanted the opportunity for their case to be aired, examined, listened to, and settled under employment law. The 12 billion supposed price tag put out by the overzealous Treasury to settle the pay claims would be a maximum figure and subjected to negotiation, but happily seized upon by a desperate coalition needing headlines to justify their bankruptcy. In subsidising the property speculators with billions in tax relief, then a foul puff to the underwrite the smoking industry. A fair society? Yeah, nah. The blue, black and yellow politicians sounds like a clapped out taxi cab, bright and flashy but going nowhere. Nat Swinney and ACT talk freedoms of speech, and New Zealand's recovery to suppress and marginalise people that we know and continue to pay low pay with disparity for thousands. My bookie friend and I have a bet that Luxon will be rolled before Christmas. The ongoing political punching bag of the public service is a sad problem. The sadder problem is in New Zealand, we are ruled by a bunch of self-serving, wealthy and Auckland politicians. Mahatma Gandhi said in 1931, the greatness of a nation can be judged by how it treats its weakest member. Presently, Aotearoa New Zealand is pretty grim and going to get worse caused by this coalition. I don't perceive low-paid and short-paid workers to be weak. They are incredibly strong, but unfairly paid and with disparity. So no decent living wage because of short-core politics. I will end by saying that I'd like to thank this incredibly bipartisan select committee for the opportunity. It's a true democratic experience. Thank you.
Kia ora, thank you very much. And I should have noted for my colleagues that Bernard's computer doesn't have a camera, so we've probably listened more intently as a result. So thank you for that. I've got Jackie and Lynn.
Yeah, thank you, Bernard, for as a private citizen with history in public service and even retrained in teaching, you're very active in your community. That's clearly from your work history, and I thank you for that. Do you have any sense that there's a good understanding about pay equity in the people you interact and meet with each day?
Not really, because it is a technical area and it also needs people to explain it with great clarity. And you need different inputs from, say, a union leader or the employer leader to present that. I mean, we've been through COVID of where we had a supreme presenter, both in the health department and in the political arena, that could take the difficult subject to the population at large and effectively won. Well, I don't think this is going to get that sort of attention. It needs it, but it's not a top headline gainer.
Thank you. Lynn Play. Sound. That's the third time she's done that, Bernard. Just saying.
I'm learning too.
Bernard, I am so sorry, and I'm really sorry that I never got to see your face because I really enjoyed your submission.
I'll send you a picture.
Oh, thank you. Okay, I love that. My question is around your vast experience. Have you really struck this before, where there's been such a instant change in policy without any consultation or anything or any warning, where many submitters have used the word blindsided? Just in terms of your experience, have you seen this before?
Within the game of politics, blindside is done quite a bit, but in one could examine and look at different governments of all colours have used urgency for different purposes. But I think this use of the urgency in this case is rather extreme in the most.
Thank you. Thank
you very much. Look, thank you very much, Bernard. That's much appreciated, and we do value the fact that you've gone to all of this time and effort to make a presentation to us. So thank you very much.
Thank you. I wish the committee well.
Thank you. Now, the next submission is the Disabled Persons Assembly, and I think Patty Poor, is that right?
Yeah.
Oh, kia ora, welcome.
Kia ora.
And we've read your submission, Patty, and but do leave us a little bit of time at the end for some questions. Thank you.
Cool. Tēnā koutou, tēnā rā tātou katoa. No ngā puia hau, he uria hau o Ngāti Hine I te taho tōku tipuna whaia aira te ao kāka, ko Peripo tōku ingoa, no reira kia ora mai tātou katoa. Ka timata ahu I tēnei whakatauki me aro ki te hā o hine ahone, ngā mihi nunu I te tautoko o te mana o ngā wāhine whaikaha me ngā wāhine whaikaha Māori. So that was just a brief introduction of, I'm from Ngāpuhi, I am Ngāti Hine on my grandmother's side, and my name is Patty. And the whakatauki I just shared was about paying heed to the dignity and power of women. So we just wanted to thank the panel for supporting the mana of disabled women and disabled Māori women. So to the People Select Committee, thank you for the opportunity to present on the DPA submission, and just for this opportunity to enhance the mana of our disabled and disabled Māori men and women. At this time, we just remember also the disabled women who have served our communities that have recently passed on. So DPA itself is a not-for-profit pan impairment organisation run by and for disabled people. Our aim is to work on systemic change to realise an equitable society based on Te Tiriti o Waitangi, the United Nations Convention of the Right of Persons with Disabilities, UNCRPD, the Aotearoa New Zealand Disability Strategy, and in a recent submission to United Nations, also UNCDOR. So, like many other submitters, DPA strongly opposes the Equal Pay Amendment Act 2025, and we are urging for it to be repealed. We are very dismayed by the lack of consultation, and that's feedback from our community and our membership, and the use of urgency in passing this act. I wanted right now to acknowledge the wahine who lead DPA for us, our CE Mojo Mathers, and our National President, Kira Sheridan Regan. Sadly, our CE Mojo Mathers is unable to join us today as we planned, but I want to pass on the following statement from her. So one of the best investments that government could have made would have been to fund the pay equity claims. By stopping these from proceeding, $12.8 billion has been taken out of the pockets of low-income, hard-working women, and these include many disabled women. These cuts to pay equity disproportionately affect women working in care and support roles. The valuing of care and support roles doubly devalues our disabled community, as disabled women are both carers and recipients of care. We know that disabled people benefit when the people who are supporting us are paid fairly. We also know that disabled women who work in these sectors, along with their families, also benefit when they are paid fairly. Now, this was something we did not mention in our submission, so I just wanted to raise it here for the Select Committee, and it's around the employment gap for disabled people, and we're aware that the employment gap is quite high. So just wanted to, so the working age disabled person currently have less than half the employment rate of non-disabled people. In June 2025, the employment rate was at 38.2%, and that's compared to 78.5% for non-disabled people. So that's an employment gap of 40.3% for disabled. So, and as we know, every New Zealander has a right to gain and maintain employment. However, it's pretty evident to us that we are a long way from achieving either employment or pay equity for disabled people. There's many systemic barriers that prevent disabled from employment, including the difficulty in accessing and maintaining equitable support. One other area which I know other people have raised is a minimum wage exemption. DPA has actually advocated for the repeal of the Minimum Wage Exemption Act 1983. In the words of NZCTU, no worker should be paid less than the minimum wage. And we add regardless of their disability, ethnicity, or gender. So currently, employers can legally pay disabled workers as little as $2 an hour. I know that previously it was mentioned $1 an hour, but it's $1 to $2 an hour, and no non-disabled person would work for that amount. This legislation and its direct impact on disabled workers, both the values of work of disabled people and entrenches discriminatory attitudes towards all disabled people. DPA was deeply disappointed with the last year the current government stopped the work being done to replace the minimum wage exemption with a wage supplement, which they claimed would save over $56 million in operating funding. As highlighted by NZCTU at the time, workplace discrimination and lack of access to work are a significant contributor to the high rates of poverty for disabled people. I'd like to wrap up with this final point. All disabled should be able to work with dignity, and we all deserve to be paid fairly for our work. To the committee members, we're now open to questions and appreciate the mana again that you gave in terms of the opportunity to share our submission and what we are passionate in advocating, which is the rights of disabled people. Ngā mihi nunui.
Thank you very much, Patty. That very powerful submission from you. Jackie Blue. Jackie, you haven't put your sound on. I have to say, this is the first time that Jackie has done it.
Yeah, I'm usually pretty good at it. I'm really sorry about that, Patty. Look, thank you so much for your submission. I appreciate that disability support workers did have a live claim that was cancelled with the 25 Act, and that's basically shut the door on any future claims. So is it possible that your organisation could make a complaint to the United Nations Conventions on the Rights of Persons with Disabilities on the fact that you've been discriminated against?
Oh, that is a good question. I do know that we have put forward submissions for United Nations, but currently we're working towards, in terms of women and girls and with justice, and the next one will be the Committee on the Elimination of Racial Discrimination, because right now that is a priority for our membership. But yeah, there would definitely be something we consider, but we have raised with United Nations around the discrimination of disabled women in terms of pay and employment.
It all takes time and resource to do this, isn't it? We've got so many
it's not mine. And all
nothing else to do.
Disabilities too.
Yeah. Okay, thank you.
Thank you. But no, thank you.
Thank you. Sue Bradford.
Oh, kia ora, Patty. Thanks so much for making the submission, and to Mojo as well. And so good. You're such a staunch organisation and face such odds. I just wondered, was DPA very involved in pay equity claims of the support workers that work in your sector before they were all cancelled?
I would have to actually find that out from our team and get back to you on that, because I'm a newbie. I've only been here a year and a half. Oh, yeah. So I will find that out from our team and get back to you on that.
Yeah. I just wondered if you'd had direct experience inside the claims, but as disabled groups of workers, like that wage exemption situation that's been there forever, that in itself can't be a pay equity claim, no? It doesn't fall under, could it?
No, it probably
I'd
needs
be
a
love-
change to the
Yeah.
law.
I was on the
It's,
select committee that dealt with that
yeah.
bill under Labor, and I have to say I was fighting my Labor friends here on that one. It's a long, hard struggle, and I wish DPA all the best with it. Just one last thing, you talked about the right to employment as being a right for people with disabilities, and I've fought in that sector for a long time, and as far as I know, there isn't a right to employment or to paid work in New Zealand, in Aotearoa. But I guess, are you talking from an international convention?
And underneath the United Nations, of the UNCRPD.
Oh, kia ora. Yeah, I thought that's what
employment.
it was.
And there is a section in the New Zealand Disability Strategy as well
Aye.
on employment.
Kia ora. And all the best for everything that you and your colleagues do.
Yeah, we're fighting.
Yeah.
Kia ora, and thank you very much. I mean, the points that you've made, and I guess I speak on behalf of everyone here. Most of us have worked with Mojo, so do pass on, our respect and gratitude for the submission that's been made, with the organisation. Thank you.
Yeah, thank you. It's great working with Mojo. It's been a wonderful opportunity for me.
I know. I was absolutely thrilled when she got that role. I mean, I was briefly the Minister for Disability Issues, and the work that went into the disability strategy, although I should name my former colleague Ruth Dyson, who played such an important leadership role in that space. The one thing that we sort of highlighted right at the outset, that what was disabling was actually other people's attitudes. And so we are dealing with other people's attitudes when we're talking about pay equity. So it's absolutely relevant to the kaupapa of this committee. So thank you very much.
Beautiful. Ngā mihi nui kia kaupapa katoa.
Kia ora.
Ngā mihi.
And thank you. And we'll move on to our last submission for the day, which is Dr. Kathy Irwin, who I also know from a past life, but is Kathy there? There she is. Hello. Kia ora. Welcome.
Thank you. Ngā mihi. Rauranga tira mā e ngā tohonga nunui te wānui a tāne. Tēnā koutou, tēnā koutou, tēnā koutou katoa. He kakono nui o tēnei. I muri a koutou e te atanei ko Kathy Irwin taku ingoa. Thank you for this opportunity to speak to this really important issue. What I'd like to do is I'd like to add a layer, I guess another canopy to stay with the metaphor of Te Wānui a Tāne, to the written submission I've made. And I'm also going to speak for 10 minutes and allow time for question and answer. So I appreciate I'm the last and time might be of the essence, so I'll get through this as fast as I can. What I want to add to what I've already presented is an analysis that uses the framework of Professor Hirini Moko-Mead's model of Māori mediation, which is the Take Utu Air model. And in doing that, I want to end at a different place in my call to action. So what I'm suggesting is that in my written submission, I've set out a number of recommendations which are working within the current system, and I guess within what I would call a Treaty of Waitangi perspective. And where I want to land today is more in the Te Tiriti o Waitangi space, following a Māori development model and the kaupapa Māori analysis. So to take his Take Utu Air model, firstly the issue. So the issue is that what we're dealing with is a state-designed system. The machinery of government itself, through policy, legislation and regulation, implemented the design of a system that was never intended to be equitable. And there was little to no chance of individuals escaping the system level impact. Now, I want to talk a little here about how it was possible to escape the impact of that system. And I'm going to use my grandmother's story. So my maternal grandmother was the sixth of 19 children born in 1899 in Nuhaka. native speaker of Te Reo, me ona tikanga, lived in her as ahikau in her papakainga in Nuhaka. But at the age of 14, born into a very strong Mormon family, the Presbyterian Church arrived in Nuhaka and brought with it a schooling opportunity at secondary level at Turikina Māori Girls College. Long story short, my grandmother saw the arrival of another Christian faith, but this one was led by women. Little peek to her number one, it brought education at the secondary level, which wasn't available widely in New Zealand at the time, number two, and nowhere near her papakainga. So as a 14-year-old, she went to her father, imagine this conversation, and said basically, Dad, I need to leave home, I need to change my religion because I've decided education is the way forward. Now, all of those things, which she did, she took up the 149th position at Turikina in 1915, all of those things created a radical paradigm of change for all of the women in our family. My mother became a teacher after her. My grandmother took up her first teaching role in 1918. My mother became a teacher. I became a teacher. I named my daughter after the old lady with her permission. And in 2014, exactly 100 years after the old lady decided education was her future and fought her father for that opportunity, my daughter, named after her, graduated Master of Law at Harvard University 100 years later in 2014. The lesson of that for our people is rangatiratanga is the solution. Now, we've called for direct funding as iwi from at the kind of national level of exchange, at least 1984 in the Hui Taumata, where following a national conference on Māori economic development, which our people felt we'd been left out of. Our people called for the Hui Taumata, developed the actual Māori development policy, and in the calling of those recommendations from that conference, one of the recommendations was for direct funding. Early intervention, direct funding, positive targeting, and that's where I want to land today with my submission and my grandmother's experience of walking completely away from the vision the state had for her, from the way in which the policy was developed around Māori affairs that she was influenced by. Her decision to take the rangatiratanga route changed her life and all of our lives after it. Number two in Professor Mead's model, utu. So after the issue, he calls for utu in the response, why this People's Select Committee is so important, and tino mihi atu ki a koutou katoa mō te tōtanga o tō koutou mahi. I can't say how excited I was to see the announcement of this People's Select Committee, because the state sidestepped its role in this issue by taking away the opportunity for the people to hold it to account through a select committee process, to examine its role in the issue, and to present evidence on its impact. Also, enabling us to have a chance to point the way forward to new solutions. All that was taken out. To use a New Zealand sporting analogy that I don't often do, like a head-high tackle. So thank you for creating this opportunity for utu to be considered, for a response to be considered. And the third part of his model is the redress. And one of the things that Professor Mead argues in his model, what I consider to be a really important part of his thinking, is that he argues that both parties need to be satisfied with the outcome for it to be sustainable. And so to have a critical national issue like this not able to be addressed through the democratic process that is usually the case doesn't really point to our chance for to get into a space where redress is not only possible but sustainable, because that's the issue. The trajectory from Orokohanga, our creation story, to Aotearoa nation building, that trajectory is not going to be as powerful as the treaty always envisaged it could be if we don't come to redress in a way that both parties feel is sustainable and is fair. So when we call then for how to move forward, as I say, my earlier written submission points to some ideas within the current system. So we've got legislate mandatory pay gap reporting, adopt a proactive pay equity model, strengthen enforcement powers, embed Te Tiriti o Waitangi in all pay equity frameworks, not the treaty, Te Tiriti, because that gives us the real Māori version, revalue feminised sectors and support inclusive collective bargaining. Where I land today is I now want to add the call to action for direct funding to iwi. If Aotearoa, the nation-building model, is so difficult to achieve through the machinery of government, and goodness knows there is so much research that sets this out now, from the Hun report, the Department of Māori Affairs annual report in 1960, which for the first time specified in sector by sector accounts the disparity between Māori and non-Māori. And over the years, the Closing the Gap reports of Te Puni Kōkiri have tried to move that gap and to work on creating better outcomes for whānau hapu and iwi Māori. That work has been slow to move, and I would argue that the research in the Māori development scholarship space presents ways forward that aren't just about tinkering with the system. The Ministry of Social Development and some of its important work in the north has trialled direct funding as a way for the state to work with iwi alongside in an Article 1 space that perhaps was first envisaged in 1840, but far more powerfully because the state gets out of the way. If the bureaucracy is part of the problem, stay with the vision, stay with the mission, but give different agency to iwi to be able to make a difference. And that's where I want to land this submission today. What we have now, as a result of the Waitangi Tribunal process, which is 50 years in, we have what we can describe as a machinery of iwi. Iwi have been required to agree with the state on post-settlement governance entity structures. Now, not all of our people are happy with the way those structures have been developed, but we've gone with them because there was no other option. So we actually now have a machinery of iwi. We have structures the state has helped to shape, and in the shaping of them, allowed the treaty settlement money to flow through them. So we have a structure. And that structure sits alongside the Māori cultural infrastructure, the traditional Māori cultural infrastructure, which was never extinguished by colonisation, attacked, challenged, but never extinguished by colonisation. And in part, that is supported by the over 780 marae throughout the length and breadth of this country. Now, when we add to that the focus that our people restated as the second objective from the Hui Taumata in 1984, the first objective was parity, unfortunately. The second objective was about focusing on strengthening Māori identity through Māori language and the heritage of the ancestors, through the marae, through the Māori spiritual pathway and Māori mind, and through tribal identity. So 1984, we've got a restatement of the focus of that traditional Māori cultural infrastructure that we still have available to us in Aotearoa. Now, one of the key drivers of that, obviously, is ukai pōtanga, our ability to tell our own story based on our traditional roots and our traditional heritage. I am mindful that the late beloved Dr. Moana Jackson always used to say to us, there are no winners in colonisation. And so trying to tell a story that makes it seem as if Aotearoa did better out of colonisation than perhaps some other lands. It's not a functional way to go ahead. Obviously, he's right. It is also correct that we are able to tell our story, because the bottom-up story of resistance and resilience in Aotearoa, supported by the Māori cultural infrastructure, is not the same as the bottom-up story of other Indigenous peoples. So there is a particular narrative to tell here, and that's why when we add all of that together, the machinery of iwi that the state has helped to create, the Māori cultural infrastructure that is our traditional heritage, guaranteed under Article 2, still practiced by us, the over 780 marae that are part of the infrastructure of Māori society in Aotearoa, and the refocus in 1984 at the Hui Taumata on how our people can get ahead through that second objective, they come together in my mind to help present a stronger basis for the call to direct funding to iwi than perhaps was the case in 1984 when that call was last made in that National Economic Forum. That's where I'd like to end my submission today. I believe our people can show evidence of working with the state. The Māori response to COVID-19 is one of those examples. To create better whānau hapu and iwi Māori outcomes than is currently the case in other parts of the machinery of government. We sit in a space urgently requiring attention in terms of the ethnic and pay gender inequities that our women face. And I was horrified to see the Human Rights Commission research in the Pacific Pay Equity Campaign establish that over a working life of a Māori woman, she will lose over $400,088 as a result of pay and gender inequity. In many parts of New Zealand, that's a house. This issue doesn't get any more serious than that. Nō reira, wahine mā, tōtara nui mā te wānui a tāne, tēnā koutou, tēnā koutou, tēnā koutou katoa.
Kia ora, Kathy, that was again and just another compelling way to present on this sort of increasingly complex issue as we dive into it. So thank you for that. I know that there are elements of what you were saying that I was desperately jotting down, but so if you've got any of the story and the tying in with Professor Mead's model, I would really value that being made available to the committee, and there may be others as well. Now we've got Sue Bradford, Steve Chadwick and Jackie Blue.
Oh, kia ora, Kathy. Thanks so much for taking the time and for making both the written and oral submission, and for taking us beyond the present in a way, quite deeply into the path towards constitutional transformation. But I'm just curious, because some of us wrestle with this in our other lives. Also, like, if we had a really good government that restored pay equity, that maybe made it even better than it was prior to May 2025, and if we had a government that picked up the challenge of direct funding to iwi that you're talking about, like genuinely picked that up, where do you see the process of like working towards pay equity? Is there a place for that into ao Māori or into ao Pākehā, or what's the relationship between those two things?
So I will go back to Apirana Ngata Ze Tipu e Rea Whakatauaki, which he wrote in the 1940s, and that's the dual worldview model. We need an and approach. We need both the things that I set out in my written submission, which is how to transform the current system. But I think we also need the other approach, which is what he encouraged us to do, to take the best of both worlds and moving forward. I think the Crown needs to downsize itself and to be able to create more space and more goodwill to work with the machinery of iwi to create change. And I go back to my grandmother's individual decision in 1914. That agency, the ability to articulate and engage rangatiratanga, is where the radical change is coming from in Aotearoa. If we think about the 2024 research that came out of Bill and the Ministry for Women, the Māori Women's Economic Report, they found Māori women's contribution to the economy over $5 billion. When they added the voluntary contribution, it went to over $12.5 billion. How is that possible? You can't understand that if you don't factor in the Māori cultural infrastructure, where all of that voluntary work is being done. So moving forward, so it does need to be an and approach. The system needs to be retrofitted and transformed to move forward. And the Crown, forgive me, but it just needs to downsize itself to get out of the way of iwi development and to transfer in a direct funding space more of the resource to iwi to do the important work that our women need. I would love it if this committee recommended to the government that it distribute to every iwi registered through the Waitangi Tribunal settlement process a set amount of money to develop a mana wahine strategy for every iwi. I'd love
Kia ora,
to do that.
Kathy.
Kia ora, Steve.
Well, kia ora, Kathy, and there's a challenge. And you really put that take on the table for us today. It's quite different. Your submission is quite different to what we've heard. I get the shudders when I hear direct funding. We're struggling so much to find, as you said, remedy and redress for very poor legislative process here. But I value your contribution in terms of looking at a Te Ao Māori lens on pay settlements. I think that's something that's been missing, and we look forward to seeing your research and your paper. So keep the battle going, Kathy, and we'll see how we can weave that strand in.
Yeah. Kia ora.
Kia ora, Jackie.
Thank you, Kathy, for an excellent submission. My question is, could your organisation, or do you know of another organisation that is planning to take a complaint to the Waitangi Tribunal that the 2025 Act as a Crown policy disadvantages Maori and how it was introduced undermines treaty rights?
Yeah, so look, so I don't know of anybody who's planning that, though it's a great idea. What I'm sitting on at the moment is the idea of taking the Retirement Commission to the Waitangi Tribunal over the statutory advice on retirement income policy. The final advice that was given, so the Commissioner has the role to give that advice every 3 years. She's about to give the advice again. I was one of her technical advisors when she gave the last advice. And, you know, she does a wonderful thing. She takes all of the advice, she publishes it, which not everybody does, but she's not bound by it. So we understood that when we were doing the research on what does retirement look like for Māori. But the advice has still come out as a one-size-fits-all. Now, when the state has had a role in materially disadvantaging Māori women across the course of their lives so that they arrive at retirement age with little ability to save, with multiple responsibilities for caregiving across our marae, our cultural infrastructure and in our whānau, and with poor health outcomes, all of which has been evidenced in the Waitangi Tribunal. The place that our people land out, particularly our women in retirement, is just appalling. And I'm waiting for the next advice to come out. The advice is due to come out just before this Christmas. I know the New Zealand Māori Council is watching the superannuation advice that comes out, and by the end of this year, we'll know where Jane's going to land with her next set of advice. My money at the moment, and the little energy I have to put into Waitangi Tribunal claims, is in that space. But I've just shifted into a new role that's got a different national brief, and I'll keep my ears open to see if anybody is thinking about a Waitangi Tribunal claim in this space. I wished I had the time and energy. My daughter is a magnificent lawyer, but I am required by her to keep my requests of her to consider Waitangi Tribunal claims to a minimum. Danny's got boundaries.
Oh, that's excellent, and that's probably a really good note to end on. Thank you so much, Kathy. You know, the work that you have done over a number of years has really contributed so much value to our nation. So, again, you've challenged us to think outside the square and to include Te Ao Māori as part of our thinking in terms of reporting back on this important issue. So thank you very much.
I'll send through the written version of the comments I added today on top of my other submission.
That's fantastic.
So much, and thank you for this opportunity.
Kia ora. Right, so that brings us to the end of the hearing today. I acknowledge Nanaia opened us with a karakia, but we don't need to close with a karakia because the hearings are ongoing. So I'll just now bring the session to a close and to thank all of the people who took the time and the energy to appear before us today. I have sat on many select committees over my lifetime, and I have to say that the standard of the submissions, the amount of work and effort that's gone into it, and the ability to articulate issues that I hadn't even begun to think of when we started down this process. I'm just truly in awe of our nation's ability to step up when there are important issues that ought to be the subject of public engagement, and to enable us to do the regulatory impact analysis around economic, social, all of those different elements that should have been done as part of a proper democratic process in dealing with such important legislation. So thank you all very much for allowing me to chair today, and we'll see you all the next time. Kia ora.